on the theme of agricultural development, challenges and responses in the post-pandemic era. First of all, we'll hear from the opening address from Yu-Hui Chen, the president of Rural Economic Society of Taiwan.
Dear Speaker, colleagues, and participants, I'm the President of Rural Economic Society of Taiwan. It's our pleasure to have you all to come to attend this 2021 Annual International Webinar on Agriculture and Resource Economics. First, we would like to express our gratitude to our co-host partner, Korean Agriculture Economics Association, and the President Hong Sen Kim for their great supports. We also like to send thanks to the sponsor of this event, Taipei Liugong Irrigation Association. Taiwan Korean Conference has been held over the past couple of decades. The goal of the conference is to promote the academic exchange and the mutual understanding of agriculture in both countries. Due to the COVID-19 pandemic, the conference last year was canceled, but fortunately the conference can resume and be held online this year, that we are able to catch up with our good friends and colleagues. Over the last year, many international conferences are held around the theme of COVID-19's impact. The pandemic would ultimately fade away, but more importantly, we should start to think hard about what might be the best way for agricultural and food sector to respond to the more uncertainties and unpredictable challenges in the future. The theme of this year's conference resonates with the current development of COVID-19 pandemic and the challenges and responses in the post-pandemic era for sustainable agricultural development. Topics this year include some very interesting research, such as bridging health behavior and health policy research under COVID-19, and the impacts of COVID-19 pandemic on agriculture sector in Taiwan, empirical evidence on Korean household food expenditure, impacts on the crop price and trade patterns in the United States, impacts on agriculture products and food consumption in India, South Korea, and mainland China, impacts on imports demand for fishery products in Japan, journey towards food and nutrition security in India, transition of consumption behavior and challenges in the post-pandemic era, and the solutions of seasonal labor shortage in agriculture. We believe this conference comes in time with addressing important issues facing agricultural and food sectors across the globe. We hope today's conference will bring in fruitful and informative discussion and reflection among you all and on the future research directions as well. Thank you.
Thank you, President Chen. Next, we will hear from Hong Sen Kim, the president of Korean Agriculture Economics Association, to deliver his speech.
안녕하십니까? 한국농업경제학회 회장을 맡고 있는 한국농촌경제연구원 원장 김홍상입니다. 오늘 2021 농업 및 자원경제학 국제 웨비나를 개최하게 된 것을 매우 기쁘게 생각합니다. 코로나19라는 어려운 여건 가운데 이번 학술대회의 성공적 개최를 위해 애써주신 첸유후이 학회장님을 비롯한 대만 농촌경제학회 관계자 여러분께 감사의 인사를 드립니다. 또한 이번 웨비나를 위해 많은 지원을 해주신 타이베이 유궁관계협회 관계자분들께도 깊은 감사의 말씀을 드립니다. 코로나19는 우리의 건강과 생명뿐만 아니라 사회와 경제 전반에 커다란 영향을 미치고 있으며 그 피해는 전 세계적으로 확산되었습니다. 이러한 가운데 식량 안보에 대한 관심이 증대되고 농업과 먹거리의 중요성이 강조되고 있습니다. 코로나19 팬데믹과 같은 위기는 개별 국가만의 대응으로는 해결하기 어려운 범지구적인 문제입니다. 그렇기 때문에 오늘과 같은 국제 웨비나를 통해 각국의 전문가들이 모여 다양한 연구 성과와 사례들을 공유하고 토론하는 것이 무엇보다 중요하다고 생각합니다. 이번 웨비나에서는 코로나19가 각국의 농식품, 생산, 소비, 영양 등 다양한 분야에 미친 영향을 분석하고 관련 사례들을 살펴봄으로써 포스트 팬데믹 시대에 농업, 농촌이 나아가야 할 방향을 모색해 보고자 합니다. 이 자리를 통해 지속 가능한 농업 발전을 위하여 우리 앞에 놓인 공동의 과제를 해결할 수 있는 지혜를 모으고 어떠한 정책적 협력과 노력이 필요한지에 대해 심도 깊은 논의가 이루어지길 바랍니다. 이를 통해 각국이 포스트 팬데믹 시대를 효과적으로 준비할 수 있는 토대가 마련되길 기대합니다. 우리 한국농업경제학회는 앞으로도 국제학술 교류에 활발히 참여함으로써 글로벌 위기 극복과 새로운 경제 도약에 기여할 수 있기를 희망합니다. 다시 한번 이번 국제 웨비나에 참석해 주신 내빈 여러분과 발표자, 토론자 등 전문가 여러분께 감사의 말씀을 드립니다. 고맙습니다.
Thank you, President Kim. For the first two sessions, we are honored to invite Professor Kuo-Ching Ling from National Taiwan University to serve as the moderator. Let's all welcome Professor Ling.
Professor, 你的麦克风没开。
Okay, so sorry, and he asked me to turn on my microphone. So everybody can hear me now? Okay, I started again. Good morning to everyone. And this morning we are going to have 5 papers presentation, and it's divided into 2 sessions. And the first session will consists of 3 papers, and the second session will be 2 papers. And so for each paper presentation will be allocated with 20 minutes. So after the 3 papers presentation, and after that, then we will have a Q&A, and then we will take a break. After that, then we continue our 2 papers presentation. Then after that, we have a Q&A. So without further ado, I would like to invite our first paper presenter, Dr. Lin Hen-yi, and he is from Zhonghua Institution for Economic Research in Taiwan. And the topic of the first paper is the impacts of COVID-19 pandemic on agriculture sector in Taiwan, discussion and estimations. And please, Hen-yi Ning.
Hi, good morning, everyone. This is Hen-yi from Taiwan. I am right now the director of Center for Science and Technology Policy Evaluation at Zhonghua Institution for Economic Research in Taipei. And it's my great honor to give a presentation here on today's webinar event. I wish our rest colleagues and KEAR Korean friend colleague safe and sound right now, and I look forward to seeing you sometime soon. Okay, so today I'm going to present you our work about the impact of COVID-19 pandemic on agriculture sector in Taiwan, discussion and estimations. This work is coordinated by me and work together with my CIER colleagues, with Feng Yiwen, Ren Hongxu, and Wei Wenlai, Yayin Yu, Xianglong Zhen, and Dr. Hong and Dr. Zhang. So I will begin with this presentation with those outline. In the first part is the background introduction. And second part is a kind of literature review, talking about the impact of COVID-19 pandemic on international agriculture sector and responses. And the third part is our estimate on the economic impact of COVID-19 pandemic on the Taiwan and domestic agriculture sectors. And the last part, I would like to present our summary and the policy insight. So in the first part, about in the background part, the COVID-19 pandemic has affected people's life all over the world since last year. And of course, the agriculture sector and food supply chain have been also disrupted due to the disease control measures by every government. And the measures such as travel restrictions and the border control have caused labor shortage in agriculture production, as well as logistics and transportation disruption, leading to food access limitations. This has further triggered the trade restriction implemented by major food exporting countries. In addition, uncertainty of food supply has sparked the panic purchase of the public. So we see these pictures. We can see the FAO food price index since May 2020. The food price index have been trending up due to the pandemic. Okay, so in this part is our international literature review for your reference. When we're talking about the agricultural impact, we will start with supply chain disruptions. In agriculture, we have supply side and demand side, and on the supply side, we have production, harvesting, post-harvesting, processing, and transportation. And in the demand side, we have retailers and the consumers. So disease control measure can lead to reduced transportation, labor shortage, halting production, supplier transitions, which will cause unemployment, food insecurity, and the poverty issues in a society. This is the picture from FAO report talking about how supply chain disruption caused by COVID-19. So as we can see, the lockdown or border control measure can affect global economic recessions and disrupt supply chains, which can relate to uneven food price, change in production, alter food environment, and disrupt social protection. So the effect even can deepening the inequity of the country or society, and finally increase poverty and the food insecurity issues will be one of the most serious problems. As we see these figures from IMF 2020, we can see in most of the countries in the world, and in several most of the category of agricultural food, we can see there is a increase in consumers' food prices. In some countries, the bread price can greater than 80%, and the rice price can be 100%, which cause a lot of issues in that countries. So economic pressure can can increase because of the pandemic, and those pressures mostly will have impact on poor families. In this slide, we can see from the figure we collect, we can see in Eastern and Southeastern Asia, in the first quarter of last year, the COVID-19 cases increased very fast in the first quarter of 2020. Also affect the CPI index of this region. And when we see the figures for Europe and North America, we can see the COVID-19 cases increase after March, and also caused their CPI for food and non-alcoholic beverages increase. So, according to our literature surveys, how international response to COVID-19 pandemic can divide to three parts. One is technology applications, which includes smart agriculture, urban agriculture, digital transformation, shifting consumptions. And the second part is export restrictions. Countries or governments can put restriction on food export, mostly by major exporting countries. And the last part is supply chain policies, which can affect the supply side, logistics, and demand side. Those are the examples we collect from our literatures. In Asia, we have introducing agriculture drones in South Korea. In Singapore, they try to implement the indoor vertical farming, agri-food cluster transformation fund to reach the goals. And the Philippines, they distribute free seed to farmers. In America, they have several measures to against the effect of COVID-19 pandemic, and they have plant-based meat alternatives, provide financial technical support, and ensuring regular function of wholesale markets, promote e-commerce preference. In Europe, in UK, they promote, accelerate AI technologies, robotic remote sensing in their agriculture. And in Poland, they started online shops, shorten the food supply chains. So this picture just want to show you that several exporting countries have banned their export, food export. For example, for rice export, Vietnam, Cambodia, India, Myanmar, they have export restrictions for several months during the pandemic. Supply chain policy includes supply side, logistics, and demand side. On the demand side, there are stimulus package, deferral or suspension of tax payment, low interest loan, and waiving fees. In the part of logistics, the government can set a collection center close to small farmers, warehouse recipient resistance, subsidy for machine and tools purchase in agriculture, e-commerce preference for smallholders. For the part of demand side, the government can issue unemployment insurance payment, one of cash payment and the pension payment. and the social protection and food assistance programs can be used as a policy to against the negative impact from COVID-19. So I will move to the third part of this presentation. We were talking about the impact of COVID-19 pandemic on the Taiwan domestic agricultural sector and responses. This is the estimate of my institution for the 2020 economic performance. As we can see, Taiwan last year we have 3.11 economic growth rate, and compared to some other major developed economies such as USA or Japan or South Korea, Taiwan have better and positive growth economic growth rate last year, and this year we expect to have 4.55 growth rate by the end of this year. The CPI index annual growth rate, we compare 2019 to 2020. And as you can see, in the world, the CPI index continue to grow after pandemics, very close to 5 to 6%, especially for the CPI of food and non-alcoholic beverages. For overall items, the CPI is about 2 to 3% last year. But in Taiwan, is a competitive law. The CPI for food and non-alcoholic beverage keep going down from the second quarter of 2020. One of the reasons could be the consumption is hugely decreased, and actually last year Taiwan have no typhoon coming, and it has been a record in the last 50 plus years. So as we can see, we don't have the disasters caused by typhoon, so the domestic agricultural production becomes very stable, but the consumption decrease, so which may cause the CPI don't have the trend to increase. So this is the figures for your reference, which explain that compared to 2019, the performance of export for Taiwan keep decreasing for crops, agricultural products, and livestock. But for impact values, we can tell too much difference because especially for crops, it may due to the shipping timings, but after all, the import value remain very similar to 2019. So our team tried to use CGE, computer general equilibrium models to evaluate the economic impact of COVID-19 pandemic. So we will set the baseline scenario first, which based on our assumptions in 2020 without COVID-19 pandemic. And second one, we try to design and set up COVID-19 policy scenarios, which include the impact on industries of the COVID-19 pandemic in 2020. And we use the official data to adjust the scenario settings. And we assume that the difference between a baseline scenario and a COVID-19 policy scenario is the economic impact of COVID-19 pandemic. So this is the more detailed explanation for baseline scenario and policy scenarios. And we try to estimate the difference between those two. Then the difference can be the economic impact of COVID-19 pandemic for agriculture in Taiwan. So in the policy scenarios, in January last year, we after the outbreak in China and the lockdown in China, so we don't have export to China. And in February in Taiwan, the government issued a warning to the public. So the hospitality and retailing industry were hit very hard by the government warnings, and most people try to stay at home and not to consume the other things outside their homes. Okay, so until June last year, Taiwan's domestic economy becomes is starting to recover, and many countries were gradually lifting their restriction, and the business start to return to normal operations. We try to use CG models to estimate the impact, and the PPS-CG model is designed by Zhonghua Institution for Economic Research in 2016. And the model can evaluate the impact of Taiwan policy scenarios and explore the economic changes in various industrial sectors. And we also can understand the indirect impact of the price and the quantity of other industries from agricultural losses. This is the macroeconomic estimation, the model structure for your reference. So the result, the estimate we have is that due to the pandemic, the impact from COVID-19 in agriculture sector, the value can be 17 million Taiwan dollars, and the GDP will be decreased by 8,600 million dollars. So as we can see, the crop production affects a lot compared to other industries such as animal forestry and fisheries. So as we can see these pictures, the lighter blue line is the BAU baseline policy scenarios. So from the beginning of last year, 2020, we assume we will have 633 million NT dollars values in agricultural sectors, and by the end of 2020, we assume that based on BAU scenarios, we assume that the agriculture value can be 649,000 million dollars. However, due to the COVID-19 pandemic, all those values are decreased. So by the end of last year, we estimate the impact overall is 2.634% decrease. So those are also in our models. We also can predict the labor needs in agricultural sectors. So from our estimate, due to the COVID-19 pandemic last year, we will reduce the labor need in our agricultural sector by 15,000 people, which means that we have higher unemployment in agricultural sector last year. So the Taiwan government passed the Relief Act and the measures on March 12 last year, and there are 7.3 billion budget for agriculture sector, and the government measure include the concession loans, interest subsidies, operational expenditure subsidies, salary subsidies for farmers, tax payment deferral and exemptions, and overseas market expansion, diversification of domestic sales, development of e-commerce platforms, and transformation of the industries. So I will proceed the summary and the postscript for my presentations. So we found that the COVID-19 pandemic had disrupted the international food supply chain and leading to an increase in food prices and food insecurity. According to our estimate, the value and GDP of the agriculture sector in Taiwan decreased 2.6%. And especially in crop, we have huge losses. Then the second harm is animal husbandries, and many countries have invested more in agricultural technology to mitigate the impact of the pandemic. Food export restrictions have been implemented by some major food exporting countries. However, those restrictions may interfere the global market. Relief and revitalization measures have been taken in response to the impact on the domestic agricultural sector of the pandemic. This is the story I try to explain to you after in the second quarter of this year in Taiwan, especially after the middle of May, we have a serious lockdown due to the pandemic and the increasing COVID-19 cases. So, however, due to the pandemic, there are several other developments for the agriculture, such as boosting the establishment of logistics management and e-commerce platforms. So, in the past, government tried to use a lot of investment to promote this, but it didn't work very well. People still go to the market to buy their agricultural products, but due to the pandemic, a lot of like Uber Eats platform service, you can order it online, and the people can drive their motorcycle to buy food for you. So in those lockdown days, those industry are booming. Also, the government tried to coordinate farmers group to send fruit and vegetables to wholesale market or individual consumers. Buyers matching also was encouraged, and the government used a National Army e-commerce system and wholesale stores, try to encourage them work together to have buyers matching. Local government and the Farmers Association support direct delivery from farmers, which is another innovation for agriculture in Taiwan. And the regional process center strengthen purchase and supply to consumers. Also, the government tried to match in the farmers' product to charity organization, which help the poor families to continue to have their food supplies. Online shopping event, which was encouraged by COA, the Council of Agriculture in Taiwan. They have several Taiwan agricultural carnivals for domestic consumers. So this is my presentation, and thank you for your listening. And thank you very much.
Okay, thank you very much, Dr. Lin Heng Ai. And he gave us a very good presentation about the global situation of the agriculture performance during the COVID-19. And also he conducted a study on Taiwan case, and his result is that the GDP growth rate in Taiwan in 2020 and 2021 actually was not too bad. It was respectively is 2020 is 3.11%, and for 2021 is 4.55%. And also for CPI of food prices in Taiwan, actually compare with other countries, actually relatively the growth of CPI is relatively low, and his reasoning is that it's due to no typhoon, and also the consumption decreases, and the import of food values actually not much changes. Based on this, it seems the COVID-19 at the end during this period has not a significant impact on the agriculture sector. However, he used the CGAE model to estimate the impact of COVID-19 on the agriculture production in Taiwan, actually decreased by 2.634%. And again, thank you very much, Dr. Lin's presentation. So now we will continue on to the second paper. The topic of the paper is COVID-19 and household food expenditure, empirical evidence from Korea. And the presenter will be Dr. Ji-Young Lee, and he's from Gangwon National University and Korea. So Dr. Young, please.
Hello, my name is Ji-Young Lee. I'm an assistant professor at Gangwon National University. So today I'm going to talk about the effect of the COVID-19 on household food expenditure. Especially, I'm going to talk about some empirical findings from Korea. So for this project, I have worked with Mi-Sung Park and Kim Lee from Korea Rural Economic Institute. So let me briefly explain the background of this study first. As you know, the COVID-19 have a significant impact on the food market, especially consumers' food consumption behavior have significantly changed due to the COVID-19. So a bunch of previous studies found that sales for food category have significantly increased compared to the pre-COVID-19. It makes sense because these days the people stay more and cook more at home. That's why their food expenditure significantly increased due to the COVID-19. And also a bunch of other studies also found that the food expenditure at each visit of the grocery store also increased. Since the people try to avoid the in-person contact in the grocery store, they actually reduce the shopping frequency and they increase the food expenditure per visit. And also another study found that the number of online consumers increased due to their COVID-19. And also since the COVID-19 have a significant impact on their economic sector, the many households have a limited budget to buy the food. So the consumers' purchasing pattern have shifted toward a lower price food with a greater shelf life. So given the importance of the consumer demand, this kind of sudden change in the food consumption sector gave many challenges to the food and agriculture market, including farmer, processor, retailer, and policymaker. That's why the understanding how consumers respond to the uncertain external change, such as COVID-19, in the consumption environment is very important. Why? Because it can help better understand consumers' purchasing behavior given the something uncertain situation. And also one of the main objectives of food policy is to suggest some direction or guideline to minimize some uncertainty given this kind of exogenous change. So by understanding consumer behavior, we can provide better direction or guideline to reduce this kind of uncertain environmental change. However, until this point, analysis on the COVID-19 has limited access to the detailed household expenditure data. And a bunch of the many previous studies have relied on the survey data or aggregate sales data. So they have something difficulty of understanding kind of details about consumers' purchasing behavior change. So in this study, I investigate the impact of the COVID-19 on household food purchasing behavior. Especially this study used the household expenditure data in Korea. Especially this study examined both extensive and intensive margin to better understand household purchasing behavior on the COVID-19. So let me briefly explain the data I used for this project. The first, I used Food Consumer Attitude Survey, which is conducted by Korea Rural Economic Institute. This FCAS is an annual survey for consumer perception for food purchasing behavior, and consumer lifestyle. So every year, 2,000 consumers are randomly selected from the population, and this data actually collect the socio-economic characteristic of consumer, general food purchasing behavior, or food purchasing behavior for the different food category, etc. And also mainly I use the household expenditure survey, which is a kind of module to the FCAS. So among the 2,000 consumers, the 500 consumers are selected from FCAS, and it actually collects the consumers' purchasing date, time, purchasing place, food expenditure, and food type, etc. So files on this HES can be matched to their core FCAS. And this HES is usually conducted from the middle of July to the end of August every year. So, as I explained it, to identify our objective, I set up the two different models. First one is the extensive margin, the effect of the COVID-19 on household purchasing behavior. To examine this, I set up the following core equation. So here, from this equation, YIST represents the household expenditure, shopping frequency, and purchasing time for individual I living in a state S during week T. And here, COVID-19 is a binary variable that equal to 1 if individual I is in their COVID-19 period. Here, XI is a control variable including individual and household characteristic, and T and S is a week and state fixed effects. Here, to clearly look at the effect of the COVID-19 on food expenditure, the food expenditure in 2020 was deflated to reduce something effect from the price change relative to 2019. And also standard errors are clustered at the state level to allow for something on kind of an arbitrary correlation between individual in a same state. So table 1 actually shows some comparison of the individual between 2019 and 20. So as you can see, individual and household characteristic is well balanced between 2019 and 20. So from our regression, so we cannot clearly interpret our main interest as a causality, but at least given this observable characteristic, we can weakly interpret as a causality. So another model we set up for the intensive margin of the COVID effect is as follows. The first, before we introduced our model, figure 1 actually shows some change in the COVID case during our expenditure survey period. As you can see, after this week, our COVID case is significantly increased. So I'm going to look at this kind of effect of the COVID case on their household purchasing behavior. To do that, I set up the following regression. So this regression is quite similar to the previous regression, but only difference is our main interest. So previously, I set up the dummy for the COVID case, but here, COVID represents the number of COVID cases during the week T. And here, since COVID case is a continuous variable, to better interpret our main interest, which is better, I took the natural log for both Y and COVID case. So here beta represents some percentage change. So let's look at our empirical result. The first, the extensive margin of the COVID-19. So table 2 shows the effect of the COVID-19 on household purchasing behavior. So our outcome variable is the food expenditure, shopping frequency, and expenditure per visit. As you can see, after COVID-19, households significantly increased their food expenditure per week. So they increased about the 7,800 won per week. But frequency does not change much, but instead they increased their expenditure per visit. So they, on average, they increase about the 6,100 won per visit. And table 3 shows the effect of the COVID-19 on people's purchasing time at a different retail store. As you can see, kind of big retail store or supermarket, the consumer actually delay their shopping time about 60 or 90 minutes. So they, by delaying the kind of a shopping time, they actually try to avoid some in-person contact in a big retail store. For the traditional market, the consumer actually visit earlier than 2019. So they visit about 40 minutes earlier in the traditional market to buy the agriculture and food product. So by doing that, they actually try to avoid some in-person contact. Other market, kind of small or combination market or online market, of course, since they have a kind of a less in-person contact in this retail store, so their kind of purchasing time does not change even during the COVID-19. So let me summarize the main results from our extensive margin result. So as we expected, households spend more for food shopping, especially compared to the pre-COVID-19, households spend about 12% more per week. And then particularly, instead of visiting grocery store more frequently, households spend more per visit. And we also found that the consumer delay their shopping time at the bigger retail store. So by doing that, actually they try to avoid some in-person shopping in a big retail store. So compared to the pre-COVID-19, consumer delay about 60 to 90 minutes when they visit the bigger shopping place. And also consumer visit earlier, kind of about 40 minutes early when they shop at the traditional market. And then by doing that, they actually try to avoid some in-person contact in a place. So let's look at our result about the intensive margin, and table 4 actually shows the effect of the COVID case on the household purchasing behavior conditional on the COVID-19. So our outcome variable is quite similar to the previous one. So as you can see, even though COVID cases increase, our household food expenditure is quite constant across the week. However, when the COVID cases increase, households actually try to avoid shopping place. So they reduce the shopping frequency. Instead, they actually increase the amount of money per visit. So if the COVID cases increase by 1%, actually they increase expenditure by 0.12%. And table 5 is the same result, but I checked the consistency of our result. Instead of the continuous variable, I include the dummy for the COVID case. So this is equal to 1 if the individual is week 5 and 6 and 7. So as you can see, our result is quite consistent from the previous one. And table 6 shows the effect of the COVID case on the purchasing time at a different retail store. As you can see, even the COVID case increase, people's shopping time is quite constant across the week. So even the COVID case increase, consumer does not change their shopping time across the different retail store. And with the dummy variable, our result is quite consistent from the previous one. So when the COVID case increase, people does not change their shopping time. The previous extensive margin, when the COVID happened, people actually change their shopping time. But when the condition on the COVID-19, when the COVID cases increase, the consumer's shopping time is quite constant across their different shopping place. And table 7 shows the effect of the COVID case on the expenditure of the food type. So I classify the kind of food into the 3 categories. First one is the fresh food, and second is the refrigerated food, and the third is the frozen food. As you can see, when the COVID cases increase, households expenditure for the fresh food and refrigerated food is quite constant across the week. But households actually increase the amount of money for frozen food. So when the COVID case increase, the household actually increase their expenditure for frozen food. So this is actually quite consistent from the previous finding. So from the previous study, they found that when the COVID case increase, people actually think about the storability of the food. So that's why they just try to buy something frozen food with a better shelf life. So, and then our result is consistent from the previous finding. And this is another check for our result. And then with the dummy variable, our result is quite consistent from the previous result. Let me summarize the result from the intensive margin. So the conditional on the COVID-19, the increase in the COVID case does not significantly increase the household food expenditure. Instead, households actually spend more per visit, and they reduce the shopping frequency to avoid the in-person contact in the retail store. And then the food shopping time for each store does not significantly change during the COVID-19, but we found that the households spend more for frozen food. So from our result, when the COVID case increased by the 1%, household actually spend about 0.25% more for frozen food. So which means that the consumer actually consider kind of a storability of the food if the COVID case increase. So when the COVID case increased, household they are actually start concern about something COVID infection. So they try to avoid some shopping place, and they start to buy something food with a better storability. So let me conclude our study. As I explained it, this study examined the impact of the COVID-19 on household food purchasing behavior. Especially, this study investigates the COVID-19 effect in both extensive and intensive margin. So our main result is as follows. COVID-19 actually incurred the increase in the household food expenditure, and this increase of the food expenditure is mainly coming from food expenditure per visit of the retail store. And also, as a strategy to avoid the in-person contact, household or consumer delay their shopping time at a bigger retail store, and they visit only for the traditional market. So by doing that, they actually try to avoid some in-person contact in a retail store. And also, we found that consumers less frequently visit retail store when the COVID case increase. Instead, they actually spend more when they visit the retail store. And also, we also found that the consumer increased their expenditure for frozen food as COVID case increased. So when the COVID case increased, the people try to avoid the in-person contact, and they start to think about the food with better storability. So our result give us a bunch of the implication. The first, our result give better understanding of a consumer behavior under something uncertain consumption environment, and it can contribute on the literature about the COVID-19. And also our result give us some bunch of the policy implication. So first, given a surge in the food demand in a specific place or time, the policymaker or food industry, they need to think about a stable food supply system. As we know, many other countries actually have something food insecurity problem during the COVID-19. So they try to buy the food, but they cannot find the food in the retail store. Korea doesn't have a kind of severe problem of the food security during the COVID-19, but at least it gave us some evidence that kind of uncertain environment change can give us some food supply problem. So policymaker needed to think about something food supply system under this kind of uncertain environment change. And also policymaker needed to think about something educational effort about the food choice. So from our result, when the COVID case increase, people try to buy some frozen food. So previous study actually shows that when the COVID case increase, people actually try to buy some unhealthy food. And usually the frozen food is considered as unhealthy food, which means there's something with a kind of uncertain environment. Maybe people actually, their food choice is not rational. So they choose the unhealthy food with the unhealthy food. Under the COVID-19, in our case, the people actually try to buy some frozen food. So the government or policymaker needed to think about something educational, kind of a consumer educational about the food choice during this kind of uncertain external change. And also, since the consumer actually buying more food and cooking at home, kind of food waste can be the potential problem in their problem during this COVID-19. So we need another educational effort about the food management and the preservation skill to reduce something food waste from the household. And this is the end of my presentation, and thank you for listening. And if you have any question or suggestion, please email me. Thank you very much.
Yeah, thank you, Professor Yong, for his very insightful presentation on the effect of COVID-19 on the consumer food consumption behavior in Korea. Thank you very much. So now we will continue on the third paper presentation. The topic of the third paper is Bridging Health Behavior and Health Policy Research and the example of COVID-19. And this paper will be presented by Professor Shen-Chen Lin, and he is from Indiana University. Please, Dr. Lin.
Hello, everyone. My name is Shen-Chen Lin from Indiana University School of Public Health. Today, it's my honor and pleasure to share my experiences in bridging health behavior and health policy research with you. I'm gonna use COVID-19 as the example today. A little bit about myself. I was trained in economics in my bachelor and master programs. And then I was trained in health policy and management, as well as pharmaceutical outcomes research for my PhD. I'm currently associate professor of health policy and management at Indiana University. And then I'm also currently fellow of the American Academy of Health Behavior. And I was the former vice president of the Chinese Economic Association in North America. So this is where you can see my connection with health behavior and also with economics. In the past 10 years, I have conducted a number of health policy and health behavior research. And it is interesting that in traditional health behavior research, people focus more on individual level health behaviors. And what I'm interested in is to connect the macro level policy with the micro level individual health behavior. And the way that we use a lot is to use a socio-ecological approach as a big picture to connect policy and the behavior. In this figure, you can see we consider health behavior and health policy are linked through different levels, including individual, interpersonal, organizational, community, and then the macro level policy. In the past 10 years, I have conducted a number of research projects in different levels in this socio-ecological approach. So based on my experiences, I'm happy to share my experiences with you today and then see how I connected this all together to bridge policy and individual level health behaviors. And I'm going to share some of my tips with you if some of you are interested in conduct health economics, health policy, or health behavior research in the future. So traditionally, people are interested in health behavior alone. But now I'm interested in public policies and its roles in health behavior. So there are a few roles of public policy in health behavior, including policy as an intervention to change health behaviors. A policy can be a facilitator of behavior change. For example, under COVID-19, we want people to get vaccination, to get vaccines to prevent from getting COVID-19. And a policy can be used to restrict certain behaviors. For example, there have been the face mask mandates in many places around the world. And the policy can also play a very important role in social justice and also to mitigate disparities in health. For example, in the United States and in many other countries, we consider social and racial ethnic minorities. And we also consider people with a lower income, people in lower socioeconomic status. And in the COVID-19 situation, we also consider the distribution or allocation of resources, such as how we can allocate ventilators and vaccines when the supply is really limited. And economists are very interested in physical concerns when we are looking at public policies. For example, if we want to supply vaccines or ventilators to people, and then who are going to pay for that? Will the government be the payer, or the health insurance company, will they be the payers, or the users, the patients, are they going to be the payers? In Taiwan, fortunately, Taiwanese people are all covered by the national health insurance system. So there's a public coverage of health insurance, of healthcare services. And then when COVID-19 the treatment is covered by the public health insurance plan, then there's also physical concerns for the government. So here are a few roles of public policies in health behavior that people can consider. Based on my own experiences in conducting health behavior and health policy research, I would like to share a few tips on connecting health behavior and health policy research with you. First, I think having a theoretical foundation is very important, and having content knowledge can also help you to get meaningful policy implications based on your findings. I teach doctoral level research class every year for 10 years, and then I always tell my student that the econometrics or statistical models are not the most important thing. The most important thing is to actually draw meaningful policy or study implications based on your findings, so people can actually know how your study can be applied in real life, and in real life, what policymakers can do. Next, measurement. I think measurement is crucial, especially you want to actually draw more practical, more meaningful study implications. For example, if some person is interested in conducting smoking research, then capturing a person's smoking behavior, for example, in the past 30 days, in the past 12 months, they mean different things. Or in the past 30 days, how many days that a person smoked, or within a day, how many cigarettes does a person smoke? They all mean different things. Next one, target population, smoking again. An established smoker versus an experimenter of smoking, they are different. Or even a person who used to be a regular smoker but quit smoking, and then now the person just got started smoking again. This person is essentially different from the ones who are established smokers. So what I mean is, knowing your target population can actually make your study more meaningful to people. Next, non-econ analytical methods sometimes are very useful for economists. So there are different methods, different analytical methods that people are familiar with in different fields. And then when working with people in different fields in the past few years, I actually learned many other very useful analytical methods. I think what we can do is actually to try to learn from others in different fields, and also try to be able to know the terminology that people in different fields that can actually help as well. And then at the end of the presentation, I'm going to talk about multidisciplinary or transdisciplinary perspective. And then that can actually help us to do more creative or innovative research. And I would like to spend more time talking about health behavior theories, and then how we can apply these health behavior theories in health policy research. And then I'll use COVID-19 as an example. So why do we need theories in research and practice when promoting health behaviors? For example, we want people to keep a social distance for COVID-19 prevention. Before I tell you the answers, why having health behavior theory is important, I want to start with an example theory, which is the health belief model, HBM. So our goal is to actually let more people wear face masks. So we are interested in knowing a person's likelihood of taking recommended preventive health action, for example, wearing a face mask. And based on the health belief model, this likelihood is influenced by perceived threat of disease X, for example, COVID-19. So if a person feels he or she is at higher risk of COVID-19, then the person may actually be more likely to wear a face mask. And then based on the health belief model, the perceived threat of the disease is influenced by the perceived susceptibility of the disease, or the perceived seriousness or severity of the disease. These two jointly influence the perceived threat of the disease. And then this is the model at the individual level. It is a person's own belief about health, right? So this perceived susceptibility and the seriousness of the disease is considered individual perceptions. There are some social demographics that may actually influence a person's perceived threat of disease X. So for example, a person who is older may consider him or herself at a higher risk of getting COVID-19, or at a higher risk of getting more serious conditions if they are infected. We consider these social demographics as modifying factors. And based on the model, there are also other modifying factors. For example, the cues to action. So what may actually trigger a person's action? That include mass media campaigns, advice from others, for example, the physicians, or if there's a family member who gets sick or who are infected by the disease. Those are considered cues to action. So, for example, mass media campaign, a person sees news about COVID-19 infection, and then the person sees that there's a spike in number of the confirmed cases recently, and the person may feel he or she is at a higher risk of getting COVID. And then this will actually influence the likelihood of the person wearing a face mask. And then finally, there is one thing that may actually influence the final likelihood of taking this health action. That is the perceived benefits of prevention, minus the perceived barrier to preventive action. So for example, a person is thinking about getting a COVID-19 vaccine, but the person may actually consider the cost and the benefit of getting the COVID vaccine. There may be side effects, and then the person may have to pay for the vaccine, or the person may have to transport to a hospital or a clinic or somewhere to get the vaccine. So that's a cost. And then the person may actually think about the benefits. Okay, the person may get protected from the vaccination, but if the benefit outweighs the cost or not, this actually will influence a person's likelihood of getting the vaccine. All right, so this is how the health belief model tells us in terms of the likelihood of taking recommended preventive health actions, including, for example, wearing a face mask or getting the COVID vaccination. And then from the model, you can see we have several boxes, right? And sometimes we call the boxes as constructs. And we also see many arrows here. and you can see the paths, the directions. Based on this health belief model example, you can see having a theoretical foundation, a theory can help us to get logical explanations as well as to inform intervention or policy design. As you can see from the constructs, the pathways that are demonstrated in a model. And another reason why we want to have a theoretical foundation is having this kind of theory can actually help us to draw more meaningful policy implications. So for example, based on the health belief model, you can say that for people to adopt recommended preventive health behaviors, for example, vaccination, their perceived threat of disease and its severity and the benefits of action must outweigh their perceived barriers to action. Okay, so this is the overall implication that we can draw. And then based on different constructs, different pathways from the model, we can also provide more policy implications. So for example, based on the first box, perceived susceptibility and the perceived seriousness, we can say that if we can actually make people have a better risk perception or awareness of the seriousness of the disease, that will actually help people to increase their perception about the risk, and then that will also help them to have a better likelihood of taking recommended actions. And then based on the cues to action constructs, we know that mass media campaign and advice from others, etc., can actually help the likelihood. So based on that, we can draw the policy implications that health communication actually plays a very important role, and also to enhance the access to healthcare, and also to provide timely screening. This will also help people to have a better perceived threat of disease acts, and then consequently to have a better likelihood of taking the health actions. And then for the modifying factors, including the social demographics, we can actually consider if there are social demographics disparities when, for example, when we are allocating the resources. For example, are we consider the access to healthcare for people who live in rural areas? That's something that we can consider. And also for elders, for older adults, do we provide enough accessibility for them to get vaccines, or are we actually allocating sufficient resources for older adults or not? So this is also something that we can draw from this. Lastly, based on the benefits versus cost, then we can also provide better communication and tell people that the side effects are minimal or the side effects are manageable. So then people will have a kind of lower perceived barrier to getting COVID-19 vaccination. And also we can provide better delivery of correct health messages, and we can also provide fact check for people, so that will actually correct some of the misinformation and then provide them with better perceived benefit and better perceived cost to getting the health actions. One important thing about the health belief model is it is a person's belief. Okay, so belief means the likelihood is just the intention, but intention is different from action, right? So in order for a person to move from intention to the real action, there are a few things that we can actually tell people to do. So for example, we can provide a behavior control. So for example, a person is willing to get the vaccine, but if we can provide better accessibility, or if we can say that, okay, the government actually mandate a person to get a vaccine if the person wants to go outdoors or something, or dine inside a restroom, then that's a behavior control. Then that can actually help people from moving from intention, having the intention, to having the real action. I also want to introduce you another very widely adopted health behavior model, which is a theory of planned behavior, TPB. One important thing of the model is there's intention and also the actual behavior in this model. What influences the intention? That include attitude, subjective norm, and the perceived behavioral control. Okay, so for example, we want a person to get vaccinated. The person's attitude toward the vaccination, if it works or not, if it is dangerous or not, if it is beneficial or not, that's a person's attitude toward the vaccines. And the subjective norm, for example, a person feel everybody around him or around her have already got the vaccine, then that's actually considered kind of the subjective norm for the person to get the vaccination. And then the perceived behavioral control is, for example, the person feeling that if he or she does not get the vaccination, he or she may get a hard time traveling abroad in the future, then that may be considered a perceived behavioral control. And these all three constructs influence the person's intention to get the vaccination. And then again, intention does not equal to the actual behavior. So the TPP also wants to see what actually influences intention, and then if the intention can actually be a behavior at the end. So based on the model, we can actually provide some implications from the policy. Okay, so for example, for the perceived behavioral control, if we want to enhance that, then perhaps the government can actually make some regulation about getting vaccination. And then there should be also enforcement when the regulation is in place. And again, if we want to kind of make a person to having the intention and then finally to have the behavior, then we can actually provide some facilitators, for example, to enhance the access to resources or to make, for example, vaccine or the FastMax more affordable to people. And then we make sure that there's enough supply, enough availability of the vaccines, or we make the mandate, we provide some incentives, or we make people to get more committed in protecting themselves and others. So these are some policy means that can be used to facilitate the person to having the intention and having the final behavior. So I just give you two examples of behavior theories. There are a bunch of the theories, but I introduce the two very widely used ones. And then here is an example study that is published just recently. And then this study actually sees what predicts intention to get COVID-19 vaccines. As you can see from the figure, there are social demographics, health-related variables. They serve as control variables. But the main predictors are actually based on the health believing model, HBM, and then the theory of planned behavior, TPP, that I just introduced to you. Okay, so this is an example that based on the theories, you will be able to know what are the variables that you should include in your, for example, your model, your statistical models. What should be examined when you are looking at the predictors to the intention to get vaccination for COVID. Okay, and then, for example, under HBM, health belief model, you can see perceived susceptibility, perceived severity, perceived benefits, etc., are included in the study. And under TPP, the person's attitude, subjective norm, the perceived behavior control, PBC, are all considered as the predictors to be examined. Okay, so this is just one example that how you can apply the theories to conduct health behavior and health policy research. Here are a few final concluding remarks. Recently, we emphasize research translation way more than before. And then this is actually to help people be able to apply their research findings to real life. And in order to have multidisciplinary or transdisciplinary research, having a transdisciplinary research team is very important. And as you can see from the figure, a translational or a multidisciplinary team can be composed of researchers in different fields, including economics, epidemiology, bench science, behavioral science, psychology, etc. So you all as economists, you can see your very important role in a multidisciplinary research team. I saw an article on HuffPost a couple of years ago talking about dot connecting. And I do believe that dot connecting is really the way that we can do creative and innovative research by actually learning and also working, collaborate with people in different fields. Because there are so many things that we don't know within our field. So if you are interested in conducting health economics, health behavior, health policy research in the future, and I will encourage you to work with people in other fields. And I believe you'll be learning from others. And jointly, I believe you'll be able to do more creative, more innovative research. Thank you so much for listening. I hope you enjoyed my talk.
Okay, thank you very much, Professor Lin. And he presented a wonderful presentation on bridging health behavior and health policy research, and using COVID-19 as an example. And also he has some implication of his presentation and encourage a multidisciplinary research in this field. And I think this is a very informative presentation. So, okay, thank you very much. Now we wrap up of our 3 papers presentation. Now we have 10 minutes or 15 minutes of Q&A. So our dear viewers, if anyone, you have any questions or comments you want to make, and please, say your name and affiliation and your questions and comments. And also, if you raise a question, please tell us which presenters you address this question to. Anyone? I think the presenters or 3 of you can participate in this discussion. So, no one want to start with any questions?
Excuse me, I'm Dr. Mogna Sundari from India.
Can you speak a little bit louder? Can you make it?
Am I audible? Is it clear?
Okay, yeah. Now it's better. Okay. Carry on.
Okay. I would like to raise a question on COVID-19 and household food expenditure empirical evidence from Korea. The presenter is Lee Ji-young. And I'd like to know what is the traditional market system that is located in Korea, and the convenience shops he mentioned. Because we are from India, we are not that much clear about traditional markets in Korea. Because he concluded that some consumers are convenient in shopping in traditional markets and convenient shops. So could you please elaborate what is the traditional market?
Yes, our friends from Korea, you want to answer this question?
No, I haven't an answer, but she actually asked about our traditional market situation.
Yeah.
So you can think about right now our traditional market is become more modernized, but until this point, our traditional market is quite how can I say? It's just people just go outside and then they just show their product on the street, and then they sell the product in the kind of specific place. So based on the many findings in Korea, usually kind of people with a higher income or kind of people with the younger people, they try to avoid the kind of traditional market. Instead, they usually go to the kind of big store, or they actually use the online shopping. So I don't know what you want from the more explanation about traditional market of Korea.
Okay,
but it's become more modernized because they are actually concerned about the food safety or clean of the place.
Okay.
Clear?
Okay. Then convenient shop means? Convenient shop. Yeah, that's clear. But what about
Convenience shop.
A convenience shop.
Yeah, yeah.
Is
You
a
want to say
convenience
anything?
shop is kind of a kind of 7-Eleven or kind of a very small kind of a store, but very close to the
Okay.
kind of a house, kind of a people's living place. But usually the
Okay.
convenience store is very convenient to visit, but usually their product price of the product is a little bit higher than the usual kind of retail store.
Okay.
Okay.
What's the sample size of your survey?
Sample size?
Yeah.
So actually, I use the two data set. The first one is a kind of a household survey data, which include the 2,000 people. And then I also use the kind of household food expenditure data, which include the 500 household. But since we actually investigate about 2 months for the expenditure data, so the observation is actually much bigger. Sample size itself is 500, but observation itself
Okay.
is it depends on the how many shop, how many shop they actually do during the two months.
Okay. Okay. Thank you.
Okay, thank you very much. So, any other questions?
Hi, may I?
Yes, please.
Hi. Thank you all here connecting from Taiwan's Agricultural Policy Research Center. May I refer to Dr. Heng-Yi Lin's sharing and have the pleasure to know more about your thoughts on how the consumer price index last year in Taiwan seemed to not have been affected by the COVID-19 situation within the country. And also, may we know more about your observations on if there's already some level of transformation of the agricultural sector inside the country after the recent COVID surge in mid-May here in Taiwan? Thank you so much.
Okay, please. Dr. Lin?
Okay, thank you for your questions. And according to our data and the survey, we have found that last year, the CPI index in Taiwan is comparatively stable compared to other countries, as we see the figures in my presentations. And just like Hua used to say that last year in Taiwan, we faced that we have no typhoon summer. A lot of agricultural products, especially fruit, are grown and harvested in summer period. However, we don't have any natural disaster, so our food supply and agricultural product supply become very normal. However, because of the COVID-19, a lot of people stay at home and they pay less visits to a convenience store or a supermarket. So actually, we assume that last year the overall consumption for agricultural product is less than usual. That will cause the CPI index become much greater than other countries' CPI. Also, a lot of goods import from overseas. Actually, in Taiwan is very kind of small market. So our importing companies for especially for oil or for cereal, those commodity companies, they have their own storage, so they can avoid the delay shipping from overseas. So last year, actually, the overall agricultural commodity CPI is completely stable. So this is my explanation for your first question. However, just what I told in the last part of my presentation, in the middle of the May this year, Taiwan have increasing COVID-19 cases. So the government issued a number, the third warning situations. People will most people will work from home, and students stop to go to school, and less people go to grocery shoppings, and the restaurant are closed, shopping mall are closed, or not too many people go to go for shoppings. They will cause a change in overall consumptions. However, in Taiwan, we have observed that the logistics for agricultural product has changed a lot. In the past, our government tried to promote e-commerce platforms for agricultural product or online shopping for agricultural product, but the people use their traditional way to shop those agricultural products. But this year, due to the pandemic, people try to make their choice to stay at home. So a lot of e-commerce platforms or systems are created by a lot of private companies. Those help Taiwanese agriculture go to another way of exchange or trade. For example, like normally a local grocery store, they don't have delivery service, but in the pandemic period, people stay at home, so they can offer online ordering. Even they can deliver the order to your homes. This changed a lot in Taiwan. So this is my response for your question. Thank you.
Okay, thank you very much. So any more questions?
Professor Lin, I have one more question for our Korean friends.
Okay, go ahead.
I am very interested in their estimations because in the slide they show that they prove the frequency does not change for agricultural product and for consumptions. However, the volume of shopping increased, which means the overall consumption should increase. So it's compared to Taiwan, is very different situation. In Taiwan, the overall consumption is decreasing a lot, but according to our Korean colleagues, they predict the people still go for shopping in their traditions, and they even shop a lot compared to before. And also another question is, in your data, can you tell the difference between urban consumers and the rural consumers? Because in Taiwan, there are several differences. Because urban consumer, they will have a lot of supermarket or shopping mall or convenience store is around the corner. They can go for shopping very easily. But for rural consumers, they used to they will go to traditional market for shopping. So their consumption patterns is quite different in Taiwan. How about the patterns in Korea? Those are two questions for our Korean friends. Thank you.
Okay, thank you for your question. The first one is a frequency. So in my analysis, actually I do the both analysis. Well, first one is the extensive margin, and then second is the intensive margin. From the extensive margin, I actually checked the COVID effect on the food expenditure. And then at that result, as you mentioned, the people's frequency of the shopping does not change, but instead their kind of amount of money per visit is actually increased. So, but in the intensive margin, the result is a little bit different actually. So when the kind of confirmed case of the COVID is increased, their frequency of their shopping is actually decreased, and instead they increase the kind of food expenditure per visit. So in Korea, actually the first moment of the COVID, actually they are very fear about the kind of in-person contact in the big retail store. But luckily, kind of our government have a kind of a very good at the kind of controlling the kind of a COVID case. So kind of COVID case is not that severe compared to the other country. So after or just some time later, the people's kind of eating pattern is kind of similar to the usual pattern. But still, I mean, people just try to avoid instead of their. As you mentioned, the frequency itself is not that change much, but as you can see, their shopping time is quite different. So usually people just visit the kind of big market store after their work. So they usually visit about the 5:30 or 6 p.m. But as you can see from my result, after COVID case, they actually delay about the 1 or 1 hour 30 minutes. So I think they cannot reduce the frequency of their shopping visit, but instead, as a strategy to avoid the in-person contact in the big retail store, possibly they just change their shopping time. And then second, intensive margin, as you expected it, people actually decreased their frequency of the shopping when the compound COVID case actually increased. So there is kind of a two results. And then second comment is about the kind of urban case or local case. So for this one, I agree with you, but actually in my data, I needed to analyze one more time about the urban side or kind of a local side. As you know, as you expected it, I mean, in the urban side, kind of a consumer in the urban, I mean, they have a more chance to have a kind of in-person contact. Possibly kind of from my data, most of the people is coming from the urban side. So there are very small number of people is coming from the local side. So you can consider that my result is quite similar to the kind of urban people's shopping behavior. But for the local people, I need to analyze more time, with more sample. But unfortunately, our sample does not include much of their kind of much from the local side. As you expected, the kind of local people, they typically go to the traditional market, and then they do not really concern about the kind of those kind of thing, because I mean, as you know, kind of there is a kind of small number of people in the local side, so they are a little bit less possibility to get the kind of a COVID in contact with the people in the kind of retail store. So that one is my prediction. Yes. Is that enough for you?
Yeah,
Okay.
thank you very much.
Yeah, thank you all. I think our time for Q&A is up. And thank you again for our 3 paper presentation. And let's take a break for 10 minutes. Thank you very much.
Thank you very
Thank
much.
you.
10
I
minutes later.
have a very quick, sorry, this is Shai Tzu-Ho. So, and thank you. This is a great 3 questions, 3 presentations. So, I would like to ask a very quick question. I know that we don't have time. Sorry. Hi.
Okay. You can have, you want to have a last question.
Just last, very small.
Yeah.
So,
Okay.
just for, I would say,
you just say the country.
Professor Ling at Indiana University. So hi, I just have a question on what's your thoughts and perspective on the role of social media in terms of health attitude and health intentions, especially under this COVID-19 pandemic. Some people are willing to get vaccinated and some people are not. And currently, and you might know that the new cases in US are currently like increasing in recent days, and so there's some discussions, debates. Just wondering, like, for social media and what's the role might be playing in the model that you mentioned. Thank you.
Okay, Professor Lin.
Yeah, thank you for your question. This is a great one. Social media has been playing a very important role in influence people's health behaviors. So based on our research and also the literature, we can see people, they disseminate incorrect information quickly through social media. And then some, for example, the tobacco company, some other companies that actually target, for example, adolescents, young adults, for example, e-cigarettes. So they may pretend that they are users or they are simply just some celebrities on social media, but the back is actually tobacco industry. So in the case of COVID-19, we don't know who are actually the ones who are making misinformation, but it could be tied with political situation, political perspectives, because this is something that we can see around the world, that some politicians are actually using this as a mean to influence people's behavior. So what we have been doing is to actually look how misinformation is disseminated through social media, and also how we can actually use some, we call it the reverse engineering, how we can actually correct or help disseminate the correct information on social media. And then we also know who are we call it a hub. So who are we say either the person who has a big mouth in Chinese. So who are the hub, who are actually the ones who have some big influence in disseminating the information, and then those are something that we can target. So in the COVID-19 situation, it's especially important because vaccines are new. So people, they don't really know the correct information about the new vaccines. So that's why people's attitude could be influenced by social media a lot. And I know in Taiwan, young people are targeted by politicians. Older adults are targeted as well. So I think this is going to be a very interesting field for people to study in the future.
Yeah, I agree. I think it's an interesting topic for you to study. I think this is a big difference, between the United States and Taiwan. And of course, I think the culture and the way of the system also is as I observe, is also is a big factor in influence the individual behavior.
Yeah, that's right. Actually, I'm conducting a study looking at how kind of the information may actually influence Taiwanese people's intention of getting COVID vaccine. So hopefully that study can be published sometime soon.
I think it's going to be a very interesting research. Yeah. Good luck.
Thank you.
Okay, as I said again, thank you again, for all the, paper presenters, and also all our participants to raise very interesting questions. So hope to see you again, and let's take a break. Thank you.
Okay, thank you. Sorry, thanks.
Yeah, that's all right. Don't worry. Okay.
Okay, so session 1 has come to an end. So be back at your computer around 5 minutes. So see you guys in 5 minutes. Thank you.
Okay, shall we start now?
Session 2 is about to begin. Professor Ling will continue to serve as the moderator.
Okay, thank you very much. And we wrap up our first session of 3 interesting paper presentations. And now we will continue on our second session with 2 presentations. So is the first paper ready yet? The first paper, the topic is crop price and trade patterns during the COVID-19 pandemic, a case study of agricultural market in the United States. And this paper will be presented by Professor Ho from National Taiwan University. Is Professor Ho there? 何帅慈，你在吗？
Yeah, 我在. Yes.
Okay, go ahead.
So I think there's a video.
Yes.
Yeah. So I think I pre-record the video. So will we? Joe 在那边吗？
Okay, I will start the video now.
Okay, thank you.
Okay, thank you.
Thank you.
Hey everyone, it's a great pleasure to be here today. I'm Shatsu Ho, and this is work with Dr. Yu Hui Chen and Professor Zhou Hu. We are from National Taiwan University in Taiwan. This is a topic on price and trade patterns during the COVID-19 pandemic, a case study of agriculture markets, especially specialty crop markets in the United States. So COVID-19 caused direct and indirect disruptions to the farm sector at the immediate onset of the pandemic. Here I summarize the way that food markets was affected in 2 significant ways. That was caused by the closure of hotels, restaurants, schools, and associated institutions. The first is the structuring of hospitality or food service sector forced a reallocation of food spending toward grocery stores or supermarkets. Second, shortly after the lockdown, there could be some stockpiling behavior by consumers that drove short-term purchases. With a concurrent surge in demand for perishable produce that cannot be stored for too long would overwhelm the delivery system. And here we draw 5 examples across the United States to showcase the possible phenomenon that increased demand at grocery stores might not be sufficient to offset losses from closed restaurants and potential drops in exports. First, as different beef producers cater to different consumers, it could be very difficult for them to switch markets in such a short time. Second, overall declining demand for dairy products would add burdens to dairy farmers with more raw milk than they can sell, thereby forcing millions of gallons of milk to be dumped every day. Third, a single egg facility might only specialize in producing eggs, start turning to liquids and distributed in bulk, but such demand would vanish after the lockdown order. And the fourth is the canceled potato orders from food service industry would create potato glut in the U.S. Fifth, it's about leafy greens and other fresh produce. That 40% of that fresh produce was taken up by the restaurants. So for farmers who have already harvested their crops, they might lack enough time to find new demands before all of their perishable produce gets rotten. Also, harvesting accounts for huge cost in terms of total production cost. So some farmers would simply give up rather than harvesting. So now I'm using the last example of leafy greens to highlight the thesis of this research. Next, I'm deviating a little bit away from US case and use Taiwan as a motivating start. So on May 19, the Taiwan Central Epidemic Command Center announced that in response to a recent surge in the number of indigenous COVID-19 cases, it will raise its epidemic warning to level 3 nationwide till May 28th, and there could be extended length after this 14 days period. And there's an upcoming holiday weekend on June 25th as a national holiday. So one of the key issues here is that just less than 2 weeks after this national announcement of lockdown, they're starting in the first week of June, the downstream supply chain for delivering fresh fruits and vegetables and low temperature food products challenged by surging household demands. and those are delivered by four primary or major logistic companies: Carry, TJ Logistics, HCT Logistics, and Takubing and Pelican Logistic Company. So, and the other, the latter two companies was symbolized by the Black Cat and Pelican. So they promise that they take care of the items of their and ensure consumers' trust and hopes. So the situation is that amid the panic buying situation following a surge in local infections, agriculture companies have begun to deliver vegetable boxes to people's home. So that comes from a reduced demand from restaurants and schools, plus increasing online shopping for fruits and vegetables and groceries as a form of vegetable box. And so that surge in orders from e-commerce lead to overloading the delivering capacity facing major logistic companies. And one of the key factors is there is insufficient freezing space. So the consequences are that there's a temporary shutdown in the delivery to the consumers living in northern part of Taiwan, which account for our largest population, including Taipei, New Taipei City, Keelung, Hsinchu, and Taoyuan City. So, and the two pictures below just tell a similar story in a more vivid way. And back to U.S. case is that there's a time-lapse response. I'm using a time-lapse response to COVID-19 development in the United States as one of my key variables, as I identified 5 key periods in my empirical model later. So the first is shortly after WHO declares COVID-19 as a pandemic, Trump declares COVID-19 as a national emergency in mid-March, and then 6 months later, Midwest states sees increase in COVID-19 cases, while Florida nearly fully reopened. So there's a variation across states regarding the development of COVID-19. The last weekend before Christmas, or before the end of the years, most passengers screening at TSA since March. So, and then into 2021, in March, some states announced that reopen is likely. About 6 states announced that, and into July 2020, all states are fully reopened. So we're using the data that we're using to examine this question is US-based USDA Agricultural Marketing Service. So it's a marketing news data portal for specialty crops, and I will use the next slide, the screenshot in the next slide to talk more about the data. And then for the trade patterns, we use the FATS data from ERS. So here, this is a dashboard information, and it shows that there's 4 types of data reports, but we use retail average. And this retail average is a survey toward 400 retailers, which comprise over 30,000 individual stores who have online weekly advertisement to obtain retail data for specialty crop commodities, and they are issued weekly. So, and on the right-hand side, those filters instruments can be used to identify the commodities and regions, and including variety, unit of sales, and product type, as we would like to use the data or take advantage of a data set. And then, so now this figure shows the current situation of reopened status across states in U.S. in the beginning of July, as from the New York Times. And I'm using this figure to delineate each region specified in the data set, and I will be used as a regional dummy in our model. So there are total 6 regions, but I'm adding a national dummy. So as a whole, we have 7 regional dummies. And then before we move to the empirical part, the next 4 slides present an overview of price trends of U.S. fruits and vegetables from January 2020 to July 2021. So it's about 19 months. So the first slides of fruits and vegetables, the first panel slides of the fruits and vegetables are per pound, and the second panel of fruits and vegetables are other units. So for the per pound, we can see that apple, apricots, bananas, grapes, papaya have experienced nearly no shock after outbreak or after the lockdown order in March 2020. But the price for stone fruits went through some level of fluctuation. And then the next one is a different unit, like each, for example, each could be a different alternative unit and a 4-pound, 3-pound bag. So price trends for avocado, blackberry, grapefruit, kiwi, lemon, raspberry, orange, and tangerine stay pretty constant before and after March 2020. So if we look at them, we look at the first panel for the vegetable crops is also per pound as a unit of sale. So it's it shows that the beans, cabbage, cantaloupes, squash, sweet potato experience less shocks. But in the second panel, the units bought from each 1 pound per bag per sleeve, 3-count package, and 8-ounce package. The price went up for artichoke, garlic, lettuce, and watermelon, but spinach price goes down. So, as one added additional slides to kind of conclude the previous discussion for the overall market trend on specialty crop market. I would like to talk about the two take-home messages here is that the market seems to rebound since April 2020. So because the price index started to increase. And then the second interesting point is that this vegetable availability per person implies that a sizable reduction in food service was perfectly offset by a combination of increased grocery store and online sales, or even including farmers market, including deliveries through several food donation programs. And that means the domestic utilized production of vegetables and pulse crops were largely unchanged in 2020 despite the pandemic's negative impacts and widespread crop losses. Now it's the empirical strategy. So we're modeling the variation in prices of specialty crops over time and over those different key timing periods that we just mentioned in the timeline slides. So this approach was inspired by the paper by Mulally and Lusky in 2018. So they're examining the egg prices in California. But we are using a similar idea to say that, okay, our price here is a function of the main producing state dummy and the break dummy. The break dummy is the 5 key period dummy, timing dummy, and the interaction between break and main producing states. So, and for the subscripts and control, we will leave that to the results here. So what I'm trying to say here is there's two things that that make our study different from others from the 2018 paper is that first is I'm interested in multiple regulatory rules over multiple periods of time to maintain public health status since last January. Second, I use 5 break dummies consistently for all the crops rather than identifying independent different breaks for each selected crops. That was used by 2018 paper. So the first slide shows the overall results over the aggregate crop category, and both the left and right panel include different specifications that starts from the most parsimonious model to the most extended one, which includes product characteristics, number of stores, region, month, fixed effects, and month-year interaction effects. And I would say that multiple break models seem to be more suitable to explain long-lasting impacts of a nationwide lockdown for fruits and vegetable market compared to a single break model. In our study, different from others from the 2018 paper, is that first is I'm interested in multiple regulatory rules over multiple periods of time to maintain public health status since last January. Second, I use 5 break dummies consistently for all the crops rather than identifying independent different breaks for each selected crops. That was used by 2018 paper. So the first slide shows the overall results over the aggregate crop category, and both the left and right panel include different specifications that starts from the most parsimonious model to the most extended one, which includes product characteristics, number of stores, region, month, fixed effects, and month-year interaction effects. And I would say that multiple break models seem to be more suitable to explain long-lasting impacts of a nationwide lockdown for fruits and vegetable market compared to a single break model. And then you can say is but what we found is it seems that best or the most ideal specification didn't lead to a promising result. So now next we look into how the result might differ or still stay similar if we look into specific crops. Then I choose 3 crops for fruits, 3 crops for vegetables, and in terms of choosing main producing states, take grape broccoli and tomato as example. Their main producing states is in California, so that's in Southwest region that belong to there. So the same logic will apply to other crops. And a closer look into specific crop will reverse the single break model for all the crops. The expanded model showed that after March 2020, the apple and orange went up while it goes down for all the other crops. And then the next slide shows a multiple break model for all the 6 crops. And we can observe that amount include only region fixed effect. It seems to give the most significant estimate, but it doesn't serve as the best specification. So from apples and oranges, the pandemic effects on retail prices increased over time since the first national alert, while the effects eased down this July. But that's for apple, and it gets stronger for orange. And for grape, it's different. That reopening announcement may have reduced the retail price. So then the pandemic effects on tomato prices is consistently negative since last March. You can find a similar pattern for broccoli and potato, but that the negative trend was happening in a different year. So what we might be able to conclude here is that it seems that prices are decreasing after different lockdown orders or different key developmental stage of the government response or COVID-19 development trajectory. But what we found here is because the previous figure shows that total volume didn't change. So that means there's a perfect offset. There's a perfect reimbalance system between the food service industry and grocery store retail channels. And here, if we find there's still a reduction in prices, that might be explained by the fact that figures include all the vegetables, but here we only include 3. So that means other vegetables that are not included in our analysis here might have an opposite effects that outweigh the effect here. So that leads to a perfect reimbalance outcome in that availability per person figure. So that's one of the explanation here. And then we're moving, we might not have much time, but I will try. Okay, so 16. Okay, so let's try. Okay, there's one thing here is that this slide, the next 2 slides talks about the real exchange rate. We're not using nominal exchange rate because we really care about with the person firm, are they really better off with the US dollars or their own currency? So it's derived by multiplying nominal exchange rate by the ratio of US rate to the local currency represented by consumer price index. So what we can see here is that about these East Asian countries, there's a clear pattern that the weakening of US dollars a few months after the first national emergency. The much more depreciated status comes at the beginning of 2021. And then the EU dollar and the pound trend, the US dollar weakening also starts around May and June. But for Australian and New Zealand dollars, the weakening also starts shortly after the first nationwide lockdown. So the next 4 slides go for the import and export value for a wide range of agricultural products. Both export and import value decreased after last March, but export value starts to rise and import value starts to fall behind the export value since July 2020, which might be implied by a weakening dollar status. So, and then for here, we can see that the wine, this is for specialty crop and products. So the wine import and export remain quite stable, but the import value of fruits and vegetables dropped after March 2020 started to climb about a year later. And the export also seems to drop after March 2020, but the nuts export experienced a surge in the fall of 2020. So for commodity crops and related products, the export values remain quite stable over time. But there's a significant increase in soybean in July, so we can take a stop here. That soybean export volumes are forecasted as record levels due to surging China demand, and significantly reduced U.S. stock are driving prices higher. So that's our observation. For dairy and meat products, import and export value remain quite stable, except for red meat. So value of beef import drops from peak, and the value of red meat export rise from a bottom point, both around June and July. So, and those increasing export value might be can be explained by the high unit value. So, some of the conclusive remarks for the findings so far is retail price impacts in fruits and vegetable markets due to COVID-19 and lockdown orders could last a few months after the outbreak, only when such impact is also observed at the beginning. And the direction of impact cannot be simply explained by the regulations aiming at flattening the curve. And the potential future research include extending the study into the length of the data into 2022, plus closer investigation into specific crop industry. And apply the empirical strategy to the week level, regional level data of all the commodities without available price information, but with other useful indicators. And for trade patterns, not all trade flows among commodities reflect the impact of appreciation or depreciation of currency. More of it is driven by the demand, unit value, volume traded, and government restrictions. So, and also the relationship between trade and exchange rate, trade volume and trade values, and exchange rate fluctuation could be further disentangled by looking at specific countries. So, for example, examine the trade values with importing and exporting countries, trading partners for certain commodity. So for the last slide, it's about looking ahead and the new normal. So till the late July, U.S. is averaging about 26,000 new cases per day. And CDC Director Walensky said this is becoming a pandemic of the unvaccinated. A small handful of states with especially low vaccination rates are driving increases of new cases. And for shopping behavior, omni-channel shopping pattern for fast-moving consumer goods has increased by 50% this year, and around half of it these result in e-commerce purchases. So online shoppers became more invested, and then their brick-and-mortar counterparts in searching for their preferred and ideal product to fit their needs. So such increased planning efforts for online grocery purchases might become a new normal into the future. And third, National Weather Service has predicted that the heat wave in the Pacific Northwest will be historic, dangerous, prolonged, and unprecedented. So to give the numbers as an example, Portland and Seattle hit all-time highs of 42.2 and 46.6 Celsius at the end of June. So there are two aspects that would be severely impacted in this regard. The first is crop. The crops including cherry, blueberry, wheat, potatoes, and even milk production that will be stressed under this and even reduced under such overheated condition. And second is labor. So it would be too hot for agricultural workers to be out in the fields to do their farm work, given that level of temperature, and it's not safe for them. And the second perspective is making economy resilient to make food supply chain resilient. One way of doing that would be keep food business reopen with a cautious plan and supervision. So last, I would like to close today's presentation with a slightly added quote from an article on National Geography. Is the disasters are different, but the process and how we think about the resilience might be similar. Thank you.
Okay, thank you very much, Professor Ho. In this paper, she provided a very richful information, and actually the information included is very rich. A lot of materials included, and try to present within 20 minutes actually is not easy. So for me, actually, the speed of presentation is a little bit fast for me to digest, you know. But anyway, it's a good presentation, and this is my first time to listen to Professor Ho's presentation in English. It's really good. Yeah. So.
Yeah, and thank you. So I apologize for the background noise. It's not a very quiet space. I believe it's quiet, but I don't know why there's such a loud voice in the background. So yeah. I'm sorry for that. Yeah.
So in the future, if you know the presentation, this voice can be less noise. You know, for maybe it's because of my computer. When I hear it. Is some background noise actually make my listening comprehension a little bit affected. And since you are very young, so your speed of presentation is much faster than my old age can, digest very. You understand what I mean?
Yeah. I'm sorry. No, that's not that's my mistake. Yeah, I will correct that.
No, that's all right. Then later on we can have a Q&A. So let's continue on the second paper. The topic of second paper is the impact of COVID-19 on agricultural products and food consumption in India. and the presenter is well, it's not easy for me to pronounce it anyway. I will try it. Is Mahanasundari and Thengavel. Yeah. So she is from Indian Institute of Technology, Indo, from India. So please.
Good morning to all. It's my pleasure to present here in 2021 Annual International Webinar on Agricultural and Resource Economics. The theme Agricultural Development Challenges and Responses in the Post-Pandemic Era is a timely needed topic, and I congratulate Rural Economic Society of Taiwan for conducting such an informative talk. Let me share my slides. I hope it's visible. Let's go to the slideshow. Okay. The impact of COVID-19 pandemic in India has been largely disruptive. Almost all the sectors of the economy has been adversely affected, including agriculture. Even though Indian government allowed most of the agricultural activities under the Essential Service Sector Act, there are some crucial impacts on the agricultural sectors in agricultural production and consumption side. Let's see that. And the first case of COVID-19 as reported in India on 30th January 2020. Nationwide lockdown was imposed by the central government from March end. And currently, India has the largest number of confirmed cases in Asia. And as of June 2021, India has the second highest number of confirmed cases in the world and third highest number of COVID-19 deaths. And second wave of COVID-19 has started in March 2021. There has been a statewide and localized lockdowns by the state governments, and still few states having the lockdowns, and they are releasing phase by phase. And we are afraid we are going to face the third wave also. And so, as far as the general impact is concerned, India's growth went down to 3.1% from the 4.2% of the previous year's growth. And there has been a huge displacement of migrant workers due to the lockdown. And this lockdown increased the poverty in the country because of the loss of job and income for millions of people. As per the Azim Premji University study, around 250 million people are still 230 million people fell below income poverty line. Had the pandemic not happened, according to the report, 50 million people would have come above the poverty line. But due to the pandemic, those people could not earn much and come above. And there has been a huge stock market crash with fell in the Sensex points around 4,000 points. And let's see performance of Indian agriculture in the pandemic period. Though the growth rate is lower than the previous year, still agriculture shows the positive growth. And there has been a bumper harvest of rice and wheat just completed before the lockdown, which helped the nation to stock up some main food products. And agriculture sector was exempted from the lockdown, and even some economic activities were allowed in the green zones. That means the place where rate of infection is very less. And the vegetable prices fell up to 75% due to a lack of demand in the first phase of the lockdown. But it zoomed up in the fourth phase onwards, around 30 to 40% increase in the price. And this is about the performance of Indian agriculture during pandemic. Though industry and service sectors show negative growth rate, agriculture shows a positive growth rate of around 3%. And if we see the same gross value added, share of gross value added at current basic prices, agriculture shows a increase of 2% from 18 to 20%, while industry and service sector shows a decline in the growth. And now let's see what are all the COVID-19 impacts on agricultural production system. That means these are all the supply side issues. And first, due to the COVID-19 pandemic resulted in lockdowns, there has been an adverse impact on flow of inputs and outputs of agricultural commodities, and mainly this is the change in the availability of agricultural inputs in different subcategories of inputs like seeds, fertilizer, pesticide, and others. If we see the result, if we see the result, around 11, fertilizer shows the highest decline with 11.2% in the availability, and next comes the cattle feed and fodder with 10.8% declining. And since the availability has been reduced, the price of agricultural inputs in different sectors, different categories have been increased in all the sectors. Mainly, the cattle feed and fodder has been significantly increased. Price of the cattle feed and fodder increased 11.6%, and next comes the rental agricultural machineries. This is mainly because government used to provide some rental agricultural machineries like combine harvester for the less and free of cost for the farmers. But due to the lockdown, these government machineries could not reach the field on proper time. So they have rented out from the private players. So hence it raised the price. And this is about the output of agricultural commodities in different subcategories like agriculture, horticulture, etc. And the main impact was noticed on the poultry sectors, and poultry and egg production in Namakkal districts and other major areas have been adversely affected due to the onset of this COVID. And next comes the fisheries with 13.6% of the decline in the production. And next point, there has been huge labor shortage for harvesting and other agricultural operations at the time of lockdown. In India, there are some states in central India and northeast India, states like UP, Bihar, Odisha, Chandigarh, and northeastern states like Mizoram, Manipur, Meghalaya. These are all the main labor supply states. And some southern states like Kerala, Tamil Nadu, Andhra Pradesh, and even some states like Punjab, Haryana, those are all the mainly labor absorbing states. So laborers and poor people from these states, they move, they migrate to the other states where they find the job opportunities. But due to this lockdown, all the industries have been closed down, and they couldn't find any livelihood. So around 40% of the migrants returned to the home states during the lockdown, as per the impact study. And though government allowed the agricultural activities, there was no labor to carry out the operations. And even the combine harvesters not reached the people to harvest the crops. And mainly the April and May months are the highly labor demanding season, since Rabi crop harvest used to operate at that time. And also millions of laborers lost their livelihoods because of these lockdowns, and since they migrated to their own states. And next comes the marketing problems. This is mainly because of the logistic restrictions. And if we see the NABARD report, it clearly indicates, as far as government sector operations are concerned, the impact of COVID-19 was less. For example, procurement done by the government and the minimum support price given by the government for agricultural commodities, those impact was comparatively lesser. Because government among the total districts, 44% of the districts have been adversely affected. Government could not procure, but comparatively the same percentage of the districts have been already collected. Government has procured the food grains from the farmers, and also they have paid the minimum support price for the farmers. Since it's all going under direct cash transfers, it reaches the people on time. But people and farmers who are selling the commodities to the private sectors and who are selling to the mandis directly themselves, they are mostly adversely affected due to the pandemic. pandemic restrictions. For example, transporting to mandis, there was no transport available in the lockdown period. So 74% of the districts reported that the adverse impact, they have noticed the adverse impact, and the collection of private agencies like commission agents and wholesale traders, those people could not act on time. And so those 80% of the adverse impact has been noticed under those under that section. And also weekly markets and the hatas where farmers directly go and sell their products, that is also adversely affected around 87%, because all the market has been all search market has been stopped. And another thing noticed is, due to all other business have been wiped out, more people started selling vegetables at the started selling vegetables, so it increases the competition, it reduced the prices also. And next, this is the study conducted by the Sebalos et al. In the Haryana and Odisha. In the beginning months of lockdown, government did not define the rules and norms for each and every sectors clearly. So around about more than 80% of the farmers reported that they could not sell their commodities during the beginning of the lockdown period, but it has reduced slowly to around 6 to 33% after certain period, since government also regulated all the sectors and works, and it helped the farmers to market their products. And this next adverse impact is product price fluctuations. There has been heavy fluctuations in the products were observed in the Delhi Azapur APMC market. The prices of different vegetables fell down from 50% to up to 75%. This is the study conducted by a student, my student Prasan. And as per this minor analysis, this is orange color line is the average arrival of the tomato in the Andhra Pradesh market, and this is the average price of the tomato per quintal. And as we already saw, the arrival of the vegetable is very less in the starting period, and it has been picked up after a while, but the price fluctuation is very high throughout the lockdown period. It's because of the demand and supply gap mainly. And main reason for this increase in the fluctuations are no local trains to take the products to the market, and closure of all the Kisan mandis, and HOADIN's restrictions on import and export, disruption of demand and supply, and demand recession, etc. And another impact is due to the lack of demand at the time of lockdown. Many farmers thrown their producers and they waste. Many products have been wasted, mainly tomatoes in Madhya Pradesh and onion and papaya in Maharashtra, and especially due to the import and export restrictions, cut flower industry in Bangalore and surrounding places, and tea industries in Nilgiris and Darjeeling have been adversely affected, because the tea pluggings, first flush of the tea pluggings in the Nilgiris and Darjeeling has been has stopped due to the lockdowns, and the impact of second flush is yet to be analyzed. And also the milk and milk sweets, which is very famous in the state of West Bengal, has been discarded as waste due to the sudden lockdown restrictions. And so these are all the agricultural production side impacts. And next we are going to see the demand side problems. That means in agricultural consumption side. And first one is mainly the food inflation. So both wholesale and retail price has been increased throughout the period of pandemic. And there has been inflation of 2.3% as per the Economic Times report. And though food prices have been increased, these food price, the benefit of this food price rise has not reached the farmers. So it's mainly because of the demand and supply gap. And also the smaller cities and rural areas saw higher price rise than the urban areas because due to the efforts of corporations, all the urban areas got at least majority of the essential commodities, but due to the lockdown restrictions, reaching the smaller cities and rural areas was a very challenging issue. So prices has raised in the rural areas more than the urban areas, and prices of all type of commodities have been noticed their fluctuations. And next comes the change in the consumption patterns. Various survey studies has reported that millions of people lost their jobs and income during the lockdown period. So due to the reduction in the income, consumers started to prioritize their needs. Okay, they started to consume, buy and consume what they really needed instead of what they wanted. So there has been a reduction in the consumption of non-essentials, and due to the fear of infection, many reduced the market visits, and they also started to stocking up the products. And another thing is the consumer behavior in different zones like green, orange and red. That means most affected areas to least affected areas. All these zones equally shows, in all these zones, the consumption behavior has been changed equally. And according to the Cariappa study, and due to the awareness about now we got the vaccine, everything, but before that there was no vaccine for the COVID also. So at that time, even now also the awareness about the healthy and balanced diet system and a demand for organic commodities which boost our immune system has been increased. And this is a study conducted by my student Saad Tanishka, and as per this study, around 70 to 80% of the respondents are aware of the organic and healthy food products, and also they are even willing to pay, they prefer and willing to pay more for the organic food products. But at the same time, they reported that the regular availability of these organic products are not noticed in the market, and also there has been a non-accessibility for these products. So it shows that demand for organic and healthy food products has increased one side, but at the same time the farmers, these food products also, price of the products also increased, but farmers were wasting their products because of these supply chain problems. And next comes the food and nutritional security, and around 32% of the migrant youth reduced their daily food intake as per the study of IMBAR. And another study, Totapalli has reported 40 to 50% of the people worried whether they couldn't get the all the essential items at least, and 43% of the people reported that though they have the access, they have the access to the public distribution system, they could not buy the items from the ration shops because of the lockdown restrictions. And many households reported that there has been at least a reduction in the number of meals per day, or there has been a reduction in the number of items consumed in a meal. And 62% of the respondents have reported that they could not access to the nutrient-dense foods such as fruits and animal products like non-vegetarians, etc. And next comes the change in the shopping behavior. Due to the fear of infection, nowadays people mostly choose the online shopping, and especially old age people prefer only the door delivery system. And due to this shift in the shopping behavior, sudden shift in the shopping behavior, that affected many small and petty traders who cannot do the door delivery system or online marketing. And also online business gained momentum in various aspects like many online teachings, online webinars, tuitions, drawing and music. Many classes are going on in online itself. And so these are all the consumption side impacts we have seen. And next thing, India has so many challenges. Like already India has the population of 17% in the world, and it has, but as far as the resource is concerned, it has only 1/4 of the water resource, that is only 4.2% of the water resource, and it has only 3.2% of the land resource. And when compared to world average production, India's average production is 4 times lesser than the world average production. And also due to the increase in the global warming, climate change impacts, we have to go in a sustainable growth, that we have to reduce the emission of GHGs. Being a largest producer of rice and wheat, India has to reduce its methane emission. So these are all the main challenges India is facing already. This COVID-19 pandemic has imposed a few more challenges, like how agriculture sector is going to manage the labor shortage that arose due to the reverse migration occurred at the time of lockdown. Because industry sector is in the industry sector, they are coping up well. Even now, in India, industrial sector owners are paying for the laborers from other states to come from their own states to reach the production area, because they are even ready to pay the train ticket or flight ticket of the laborers to come back again. But this is not possible for the farmers, because farmers are not that much well-to-do in India, and also due to the loss and job and income loss, the poverty line also has been increased in general, and even in agriculture sector also. So India has to face all these challenges. And next, in summing up the conclusions, it is with various studies, it's proved that there are job and income loss due to the pandemic and lockdown restrictions, and the gap between demand and supply has been widened still, and there has been a food inflation, and but still this benefits has not reached the farmers yet, and this pandemic has made us to realize that at the time of pandemic and risky times hereafter, we cannot rely on the other countries for agriculture and food commodities. So every country has started to think about their own production, which may some experts fear, which may lead to the closed economy. And we know this COVID-19 also made us to realize whatever happens, agriculture cannot be closed down, and it should be go on, and there has been a need for sustainable management. So these are the conclusions. And as far as the strategies to recover is concerned, government has to pump more money to the economy to recover it. And so the government of India announced a variety of measures to tackle the situation worth $24 billion, and it has also announced many schemes in food security and extra fund for healthcare system and for the states also, and it has extended the deadline for tax payment and loan repayment, etc. And the Central Bank of India, RBI, also announced a number of measures worth $52 billion, and also the government should focus on the price stabilization, so that consumer also get a remunerative price and farmers get their fair prices. And till now in India, as far as agriculture insurance is concerned, it covers only the production risk, but it should also extend the insurance to cover the revenue risk. And the government public-private partnership intervention is needed to revive the demand and supply of the economy, and there should be a need of more value addition of perishable commodities, which can be implemented through the farmer producer companies, which are coming up nowadays. And so we hope we can able to cope up with this strategies, and we can succeed after that. And thank you very much for your patience. And now the question, and I also would like to thank Professor Chen and the Rural Economic Society of Taiwan for providing this opportunity. And now we can go for question and answers. Thank you.
Okay, thank you very much, Dr. Tangavel, for her informative presentation on the case of India and to present the impact of COVID-19 on agricultural products and food consumption in India. And now we will go to the Q&A session. So anyone still with us? Yes? Professor Ho, are you there?
Yes, yeah, I'm here. Thank you.
Yeah, so let's see you.
Yeah, it's good to see you too. So,
Yeah. So I thought you cannot leave, you know. This session is not over yet.
I'm just mute. I'm just hidden here. So can I have some quick questions for Professor Tangavel? Professor Tangavel, her presentation is a very interesting topic. So I have some quick question on. So you mentioned, like, I believe perhaps at the close to the end. So I'm kind of interested because you mentioned that the rising awareness also raised the demand for healthy food purchases among the Indian population. But also, we also find that there's some reduced access to nutrient-dense foods, so the consumption level also reduces, perhaps because of the supply disruption or the change in demand. So, so what might be the potential inconsistency between these two phenomena? Thank you.
Yes.
Thank you. And
sorry,
do you have any questions?
Yeah, you can answer this first. Then I will ask others whether they have other questions.
No, actually, it's not clear.
Okay, so I can say it again. Sorry, it's not clear. So I remember that in one section of your slide, it says that there's an increase in awareness that raised the demand for healthy food among Indian population. But also,
still your voice is breaking. Can you please repeat
Okay,
it?
my voice is breaking. Okay, so one thing I can do is I can chat. Okay, I can put down my message, and I will let someone else is trying to ask you questions.
Okay, sure.
So I will put down my question in words. Okay. Okay. Sorry. Thank you.
Okay, Professor Ho. So how about others? Anyone want to ask two of them any questions or comments? No one. No one. It's my turn. Okay. So we'll ask Professor Ho. You are conducting the research on the effect on United States agricultural sector during the COVID-19 period. So I'm curious, during this period, actually, not just COVID-19 has a great impact. I think climate change during this period also have a great, as you mentioned. So first question is very simple. When you use this kind of model to assess the impact, how are you going to take into account other maybe even more important factor like climate change, because the agriculture sector is very much affected by climate change. And also, the United States is a major agriculture and agriculture product exporters to other countries. So what happened outside United States and or the whole international market is going to have a great impact on domestic price in the United States. So no, you just use a simple way to answer. I know it's very maybe is more complicated. I don't know, or your model is already taking into account this effect. The second question is that I have observed that actually the price performance during this period in the United States, domestic price, actually quite different. Some products actually very stable even during this period. Maybe due to the market structure and also how they marketing this kind of products. So I think it will be interesting to show that some of the product actually has great changes during this period. However, a lot of products are actually very stable. So how do you explain this kind of phenomenon? Because you only pick three products to do this kind of empirical work. So I'm just curious, whether there's some kind of research can be done to show that why some market actually not very much affected by this kind of pandemic. Please,
Yeah.
these two simple questions for you.
Yeah, thank you. It's not simple. It's like it's important and it's interesting. Thanks. So these are good questions. So first, in regarding the model, so it's I'm afraid that this is not a structural model. So I'm simply using kind of I make perhaps I'm making some of the assumptions to make things more simplistic, but I believe you're right. So like climate change. So for example, like a heat wave in Pacific Northwest, and also the drought, I think last year that hit the Midwest as well. So those things, I was kind of thinking that besides this is besides my current model, I was also thinking about using some of the structural approach to look at things more comprehensively, including besides the COVID-19, and also include the trade disputes, the tariff, the change in tariff level between U.S. and other countries, as you mentioned, because U.S. is a main trading partners with a lot of countries. For example, the soybean exports to China. So those are things, and also for the weather conditions. So I was kind of thinking of using a different way. So, but you're right, I didn't include those impacts in the current model. So if we would like to use that, we need to rethink the model in a more creative way. And another thing is, for the second question, in terms of the crops, so the reason that I choose only 3 crops is because I observed there are 79, 78 crops in that data set. So I can do every crops, but I don't have that much space. But that's a good question that I can go through further, because the reason why I was showing the descriptive analysis at the beginning because that empirically I found a quite different results from those descriptive analysis. We might see a flat curve in those summary analysis, but afterward, if you use empirical model to estimate such price impact, we do found such potentially a positive or negative trend of those prices. So you're right. I think digging into a different crop markets that have very different, like for example, growing stage, like a different harvest season or different market structure or very concentrated demand in certain region, that would also lead to a different results. So you're right. Thank you.
Okay, thank you very much. How about other viewers who want to raise any questions or comments? Okay, if no, actually we have already, a little bit over time. Now it's 12:18. We're supposed to end around 12 o'clock. So, two of you, if any last word you want to say, Professor Ho and Dr. Tangavel? No? So you agree we are close this session?
Yeah, I would like
I
to
think
say thank you.
Professor Ho, you can type the question in chat so that I'll answer that after.
Yeah, I'm still typing. So
Okay.
give me one more. Yeah, I'm still typing my question. Yeah, in case that yeah.
So you want me to wait for you, or you can just have a conversation afterward?
Yeah, we can have a conversation afterward. We don't have to wait for me.
Okay.
So thank you. And thank
So
you.
thank you everyone. So we will close this morning session. Bye bye.
Bye bye. Thanks.
Thank you.
This concludes the first half of the webinar. The second half will begin at 1:30 p.m. Taiwan time. Please be back to your computer on time. Thank you. Good afternoon, ladies and gentlemen. For the afternoon session, we are honored to invite Professor Zhitan Fu from Suzhou University to serve as the moderator. Let's all welcome Professor Fu.
Okay, can you hear me? Can you hear me? Yes? All right, okay. Now, okay, in this afternoon, okay, we have, I'm sorry, maybe India is not afternoon. India is still in the morning, right? It's about 11 o'clock, I guess. So, anyway, good day, everybody, okay? I'd like to, in this afternoon session, we have, section 3, we have 3 speakers, okay? Oh, there are Song Dai-jae from Seoul National University. Can you say hi? Okay, Dr. J, thank you. And the other one is Mr. Xi Junfu from National Zhongxin University. Please say hi. Okay. And also that we have Dr. Preeti Sharma from Indian Institute of Technology. Say hi, okay. All right. Okay. According to the agenda, okay, each of you have about 20 minutes to present, okay. So we have 3 papers presented. Then we have a Q&A section for 10 minutes, okay. To be on time, so I like to first one to invite Dr. How do I pronounce it? G? So I can't hear you. I cannot hear you. Can you? Do you open your mic? Hello?
Yeah, you call me Dr. G.
G. Okay, Dr. G.
Yeah.
Okay. Dr. G, you have 20 minutes, please. Thank you.
Good afternoon, everyone. My name is Song Tae-ji. I'm from Seoul National University.
Hello, it's not very clear to hear the voice. Hello? I cannot hear your voice very clear, Dr. G. Can everybody hear it?
I'm sorry, I'm having problems here. Can we wait like give me a few seconds?
Okay. Wait.
Good afternoon, everyone. My name is Song Tae-ji. I'm from Seoul National University. My topic is the effect of COVID-19 on food consumption, comparison between Daegu, South Korea, and Wuhan, China mainland. There are main contents including background, risk recognition, food consumption channels and methods, changes in food purchase, changes in nutritional status, empirical analysis, and conclusion. As you know, starting in Wuhan, China mainland, in February last year, COVID-19 had spread worldwide. Fortunately, after about a month, the cases of COVID-19 decreased dramatically. Around the same time as Wuhan, COVID-19 occurred in Daegu, South Korea, and spread across the nation. Similarly, the cases of COVID-19 decreased a lot in Daegu since about a month later. So we can say these two cities have many things in common. I mean, the two cities are the most damaged areas by COVID-19 in China and Korea. And the residents were facing many challenges in their daily lives. Even the cities lost their socio-economic functions, and it caused the imbalance in food supply and demand, affecting residents' food consumption. So the purpose of this study is to evaluate food security through changes in food consumption of residents in Wuhan and Daegu after the outbreak of COVID-19. Especially, I expected that it could have a large impact on accessibility and nutrition among 4 pillars of food security. On April 2nd to 5th, 2020, we conducted online survey for female residents in Daegu and Wuhan, respectively. And we got 3,072 and 3,086 samples. Most of the residents of both cities responded that COVID-19 has a lot of impact or a very large impact on their normal life. But Daegu residents expected that COVID-19 would continue for longer compared to Wuhan residents. I'd like to compare the food consumption channels and methods between Wuhan and Daegu. The percentage of food purchases online and offline was similar before COVID-19, and the change in proportion after COVID-19 was also almost the same. Daegu residents had better access to offline stores compared to Wuhan residents. 65.4% of Daegu residents had offline stores within 5 minutes on foot, and only 23.6% of Wuhan residents have them. Large supermarkets had the highest proportion in Wuhan before COVID-19. It was almost 34%. And other channels had similar proportions. Those were under 20%. In Daegu, the proportion of large supermarkets is the most higher also. It was almost 45%. And the proportion of small supermarket is also higher. It was 23%. After COVID-19, the proportion of large supermarkets fell 11 percentage points in Daegu, while it increased 3.2 percentage points in Wuhan. Wuhan and Daegu have almost the same ways of food consumption. However, the proportion of HMR in Wuhan was a little higher, and the delivery food was a little higher in Daegu. The following diagram shows the changes in food purchases. After COVID-19, the proportion of residents whose food purchases decreased was relatively high in Wuhan. The proportion of residents who responded that food purchases decreased was 58.3%, and 32.6% said that it increased. Meanwhile, the proportion of residents whose food purchase increased in Daegu was relatively high. The percentage of residents who responded to food purchases increased was 53.4%, and only 16.2% said that it decreased. Both Wuhan and Daegu residents chose the difficulty of going out for shopping as the main reason for the decline in food purchases. And in Wuhan, the ratio of the residents who chose the shortage of product to purchase in the store was relatively high. Maybe this is because marketing system did not work well due to the reasons such as lockdown and panic buying. Most of the residents chose the time spent inside the house increased or decreased eating out as the main reason for the increase in food purchases. In Wuhan, the proportion of residents who chose for stock up on food was relatively high. This means that panic buying was more common in Wuhan. The following table shows the changes in the purchase of major food items after COVID-19. The purchase of ramen, HMR, snacks in Daegu increased a lot. Wuhan residents' purchase of rice, ramen, HMR increased significantly. Meanwhile, delivery food purchases declined a lot. This is because the delivery service system did not work well. The following diagram shows the changes in nutritional status. 26.7% of Wuhan residents were in worse nutrition, and 43.3% were in better nutrition after COVID-19. Most Daegu residents had no change in nutritional conditions, and only 12.8% of them were in worse nutrition, and only 16% of them were in better nutrition. After COVID-19, the household with improved nutritional status in Wuhan have high income levels, and among them with poor nutritional status, the proportion of household with low income levels is high. In Daegu, there is no significant difference in the income distribution of households with improved and poor nutritional status. The proportion of households with improved nutritional status in Wuhan after COVID-19 was relatively high in online shopping frequency. In Daegu, there is no significant difference in the distribution of online shopping frequency between households with improved and poor nutritional status. The following is the result of empirical analysis, especially this study focused on the correlation between income and food purchase, income and nutritional status. The analysis shows that after COVID-19 in Wuhan, the higher the income, the higher the food consumption, and the better the nutritional status. That is, the lower the income, the weaker the food security. In Daegu, the result is not significant. Last is conclusion. we can conclude that the food security of Wuhan residents was more vulnerable than that of Daegu residents after the outbreak of COVID-19. Following table shows through 4 pillars of food security, the food security of the residents of Wuhan, China, and Daegu, South Korea after COVID-19 could be compared. In particular, in Wuhan, residents with low incomes tended to reduce food purchases, and then their nutritional status tended to get worse. In other words, when faced with the risks such as COVID-19, food security for residents with low incomes may become more vulnerable. In Daegu, the commodity distribution system worked relatively well because there was no lockdown when COVID-19 broke out. And the food distribution in infrastructure, such as offline stores and delivery services, has developed well compared to Wuhan. Especially online shopping and delivery services have become more active since the outbreak of COVID-19, contributing greatly to food supply. Because there were few side effects such as panic buying, food supply and demand could be balanced to some extent. Thank you for your listening.
Professor Fu, you need to open your mic.
All right. Thank you for the good presentation from Dr. Ji on the effect of COVID-19 on food consumption and the comparison between the Daegu, South Korea, and Wuhan, China, mainland. Okay, and this study has varied the food security for 2 cities through the survey to the residents. It's very interesting. Okay, but we saved the question for the Q&A section later on. Q&A. Okay, I'd like to invite the second speaker. Okay, Mr. Xu Zhongfu from National Zhongxin University. Okay, and presentation title is Estimation of Import Demand for Fishery Products under the COVID-19 Evidence of Japan. Mr. Xu, you can do it. You can go on now. Yeah.
Good afternoon, everyone. My name is Chunfu Xu, and I'm a PhD student in Department of Applied Economics, National Zhongxin University. The topic of my presentation is Estimation of Import Demand for Fishery Products under COVID-19, Evidence of Japan. This presentation is divided into 5 parts. I want to begin by introduction, and then I'll move on to literature review. Next, I'm talking about research methodology and empirical results. And finally, I will land on our conclusion. Let me begin by giving you some introduction about this issue. Fishery products are one of the largely traded foods in the world, and most countries have trade activity in fishery products. The total production, trade, and consumption of fishery products are regarded highest in 2018. Especially, international trade reached 67 million tons, with a total export value of $164 billion, accounting for nearly 38% of capture and agricultural fishery in the world in 2018. According to the data of International Trade Center in 2019, the top 4 main importers of fishery products are the European Union, the United States, China, and Japan. Under the impact of COVID-19 in 2020, the world's economy has been greatly damaged. The domestic and international supply chain have been affected, and the import demand of fishery products are also greatly affected. According to this figure, during the COVID-19 outbreak in January 2020, the imports of fishery products in Japan declined and reached its lowest point in May 2020. However, after Japan lifted first emergency declaration on May 25, 2020, the imports of fishery products has gradually recovered. So, the structural changes for import demand of fishery products and related illegalities are worthy of further investigation after the pandemic of COVID-19. The aims of this study is to estimate the expenditure on price and gross illegality of top 5 importing source countries on shrimp, salmon, albacore and tuna, crab, and cuttlefish in Japan by using the dynamic, almost ideal demand system model in monthly data. Second, considering the impact of COVID-19 for import demand structure of fishery products in Japan. Third, fills the gap in the discussion on the method of modeling import demand on fishery products in Japan, which could provide as a valuable guideline for the government and policymakers. Now, I would like to move on to the second part, literature review of the presentation. In the previous studies on the import demand of agricultural products, the ACE model is mainly employed to estimate the relative price illegality of importing source countries. Among them, the categories of agricultural products can be classified into fishery, meat, fruit, and so on. Since the European Union and the United States are the largest trade markets in fishery products, previous studies focus on the import demand of fishery products in the European Union and the United States. Considering the increasing focus on import demand in Asian market, modeling import demand of fishery products from a space in Asia is extremely crucial and needs further investigation. A low static ACE model is usually employed to estimate the relative price illegality on the import demand of fishery products in previous study. The dynamic ACE model assessing the short-run instantaneous adjustment effect could help understand how the COVID-19 pandemic affects the structure of import demand. In addition, there are different frequencies of data used in previous literature, such as yearly, seasonal, and monthly. Due to the incomplete acquisition of data in the early stage, illegalities of various import source countries could not be distinguished for specific fishery products. Therefore, preceding empirical studies focus on the import demand among similar fishery products, such as fresh, foreign, and smoked salmon. After trade and custom information became more complete, trade value and quantity on more detailed HS code products level are employed in empirical analysis. The previous findings for import demand of fishery products show the relationship among different fishery imports of substitute. When formulating relevant price, the illegality analysis of fishery products could provide as a valuable guideline to retailers or processors for reference. Now, I would like to move on to the third part, research methodology of the presentation. In our data, each trade commodity is classified based on the HS9 digit codes. Considering numerous fishery imports in Japan, the official statistics of Japan categorize the similar HS9 digit commodities into the principal commodity code list. Regarding the large revision of the HS code in 2012, we use the top 5 fishery products of import value as the research targets, which are shrimp, salmon, albacore and tuna, crabs, and cuttlefish, from January 2012 to December 2020. The figure here is largest imports of top 5 fishery products in Japan. Due to foreign exchange markets and rising prices in overseas markets, the imports of fishery products significantly dropped in 2013. It was also the first time that the imports of fishery products fell below 2.5 million tons since 1989. Amongst them, shrimp were affected by disease, resulting in the largest decrease in imports. We use the dynamic almost ideal demand system model, which is able to distinguish the short-term and long-term responses in the markets, where lambda is a coefficient representing instant consumer adjustment to change in real price and expenditure. P is Long Price Index, which is suggested by Deaton and Milberg 1980. The model becomes a linear approximate almost ideal demand system model. COVID is a COVID-19 dummy variable regarding 1 after January 2020 and 0 otherwise. The S model has to meet the 3 conditions of adding up homogeneity and symmetry. The expenditure and compensated price elasticity are calculated by the arithmetic parameters of the S model and the average import share. Due to the higher frequency of monthly import data employed in current study, a 0 or a missing data are easily occur. Therefore, we conduct this problem by performing a chalk price to solve the untraded prices. Except for the rest of the world, the main import source of shrimp, salmon, albacore and tuna, crabs, and cuttlefish are Vietnam, Chile, Taiwan, Russia, and China. Salmon imports from Chile and crabs imports from Russia accounted for nearly 60% of the salmon and crab import markets in Japan. So Chile and Russia have competitive advantage of salmon and crab import market in Japan. The average import price of albacore and tuna from Taiwan is lower than other source countries, while its import share is the largest compared to other source countries. Therefore, Chinese exporters may adopt price competition strategy to increase import share in the import market of albacore and tuna in Japan. Now, I would like to move on to the fourth part, empirical results of the presentation. The arithmetic parameters are shown in table. The arithmetic coefficient of short-term COVID-19 dummy variable has no significant impact on imports regarding the 5 main fishery products, because Japan has taken a short time to implement the first emergency declaration. After the pandemic of COVID-19, the fishery imports in Japan has gradually recovered to the previous level after a brief decline. The result of expenditure elasticities of the top 5 import source countries and rest of the world for the 5 main fishery products are greater than 1 or close to 1, indicating that fishery imports are luxury goods for consumers in Japan. In addition, the import source countries of shrimp, salmon, albacore and tuna, crabs, and cuttlefish have the largest expenditure elasticities in India, Russia, Australia, Canada, and China. The compensated own price elasticities of 5 main fishery products are significant and negative in line with the law of demand. It means that the fishery imports from top 5 import source countries are regarded as normal goods. The own price elasticity of shrimp imports from Thailand, Indonesia, and Argentina salmon imports from the top 5 import source countries and rest of the world. Albacore and tuna imports from Malta. Crabs imports from Norway and China. Cuttlefish imports from Peru and Morocco are greater than 1. It means that consumers are very sensitive to the prices of fishery products from these import source countries. Therefore, these import source countries can adopt low price strategies for fishery imports to obtain greater revenue. The table shows the capacity cost elasticity of top 5 import source countries for 5 main fishery products in Japan. In terms of shrimp, Vietnam and Indonesia are substitutes for each other due to the geographical proximity of Vietnam and Indonesia. They are the main import source countries of shrimp in Japan. Indonesia has a greater degree of substitution of shrimp imports than Vietnam. In terms of salmon, the salmon imports from Chile is a substitute with other source of countries. When the import price of salmon from Chile increased by 1%, the import demand for salmon from rest of the world increased by 2.4179% as a great substitute. In terms of albacore and tuna, when the import price of albacore and tuna from Taiwan increases, the import demand for albacore and tuna from China and South Korea rises. Conversely, when the import price of albacore and tuna from China and South Korea increases, the import demand for albacore and tuna from Taiwan rises. Therefore, Taiwan has a substitute relationship with China and South Korea. In terms of crabs, China substitutes with Canada and Norway. On the other hand, the import price of crabs from China is cheaper than other import source countries. So, when the import price of crabs from Canada and Norway rises, consumers in Japan will choose the cheaper crabs from China. In terms of cuttlefish, as the main source countries of cuttlefish import markets, China substitutes with Vietnam and Peru. When the import price of cuttlefish from China rises, consumers in Japan will increase the demand for cuttlefish from Peru. In addition, the average import price of cuttlefish in Peru is lower than other import source countries, and the own price elasticity of cuttlefish imports in Peru is greater than other import source countries. So, Peru may adopt the low price strategy to stand in the import market of cuttlefish in Japan. Let's conclude my presentation. First, our findings show that the COVID-19 has no significant impacts on import demand of fishery products in the short term. Second, the expenditure elasticities of fishery products from main import source countries is greater than 1 or close to 1. It means that the high dependency for fishery imports by consumers in Japan, so the fishery products of main import source country has export potential in the Japan import market. Third, the own price elasticity of 5 fishery products from top 5 import source countries are different, suggesting different marketing strategies adopted. Fourth, the expenditure elasticity of shrimp imports from Vietnam and rest of the world, albacore and tuna imports from China, cuttlefish imports from Thailand are close to 1, and their own price elasticity are the least sensitive compared to other import source countries. Therefore, they have greater export potential in the import market. Finally, there are several limitations concerning in this study because the world is continuously affected by COVID-19. The current study can merely cover the data periods of COVID-19 during January 2020 to December 2020. Suppose the epidemic is under control in the future, the adjustment speed of main fishery imports affected by COVID-19 could be investigated more in detail. That's my presentation. Thank you for your time.
Okay. Thank you, Mr. Xu, on the import demand for fishery product, or impact from the COVID-19 evidence from Japan. Okay. I also suggest that we are going to save the questions for the later on that the Q&A section. Okay. So now I'd like to invite the third speakers on the paper of. Wait a minute. Okay. The presenter will be Dr. Preeti Sharma on the journey toward food and nutrition securities in India, challenges for the post-pandemic situation. Dr. Sharma, please.
Good afternoon, everyone. I am Dr. Preeti Sharma. I am from the Indian Institute of Technology, Indore, located at Indore in India. And before I begin my presentation, I would want to heartily congratulate Professor Yu Hui Chen, who has organized this webinar, who is the president of the society. And I also am very grateful to him for inviting me for this webinar. And also, I heartily congratulate him for organizing the webinar on such a contemporary issue, which all the countries as well as all the governments, they are presently facing this pandemic situation. And more importantly, we have to prepare and plan for the situation, where the challenges which we are going to face once this pandemic situation gets over. And in view of that, I am now going to make my presentation. So my presentation mainly relates to journey towards food and nutrition security in India, challenges for post-pandemic situation. So basically in this webinar, in my presentation, what I'm going to do is I'm going to take you through through how the government of India has implemented and also made policy towards the benefit and welfare of the farmers, as well as the poor urban and rural consumers who are not farmers and who don't produce, who are not capable of producing food by themselves. So in today's presentation, I'm going to take you through that entire journey of India. So as you would all know that India got its independence in 1947, and before we got the independence, in the pre-independence era, there was no investment in agriculture sector. There were heavy land taxes which were being levied by the then British government, and the farmers were rendered very poor, and that was also mainly because they had to pay a huge amount of land taxes, and they used to borrow money from the local money lenders in order to undertake cultivation. And most of these farmers were indebted in such huge amounts that they could not undertake any development in or any improvement in their way of cultivation. However, after the independence, after 1947, the policymakers, they had two objectives in their mind. Number one was to pull out the farmers from massive loans which they had borrowed, and this could not have been done if the government would not have aimed for reducing the power of big landlords. And second objective of the policymakers was to also simultaneously raise agricultural productivity. And in order to achieve these two objectives, the reformers, the following two reforms, major reforms were undertaken. Number one was that the tenancy reforms, that is, the cultivator, after a certain period of cultivation of land, also becomes the owner of that land. And there were major reforms in land ownership and cultivation rules. And also there was the abolition of zamindari, which is the zamindars were the feudal landlords who were deputed by the British government, and they used to seek taxes in the form of agricultural produce from these cultivators. And second thing that was implemented was establishment of large scale and small scale irrigation projects, establishment of fertilizer industries, establishment of research agencies, extension agencies, and the universities. And all of this was aimed towards first step, which was to achieve food sufficiency. And then how we moved on from sufficiency, and that movement, that growth could not have happened without aiming for agricultural growth, and which was achieved and targeted through Green Revolution. So during the time phase of 1949 to 65, India saw a growth rate of about only 3% in agricultural production or agricultural productivity growth. And from 1965 to 66, the major droughts had happened, and that was also the time when India underwent two wars with its neighbors. And these situations, the major droughts that led to famines in the country. And that was the time when the government realized that it is important for us to be completely food sufficient country, because we had to import our food grains at very high prices from international markets. And that was the time when introduction of high yielding varieties was undertaken, and that was under the new agricultural strategy, which is now all of us we know is famously known as Green Revolution. Now, Green Revolution led to the increase in production of certain kinds of cereals, and mainly it was rice and wheat crops. And in addition, later on, there were sugarcane and other cash crops as well. So this is the kind of policy which was undertaken by the government from the production side. And at the same time, the government also wanted that these farmers needed price support system. So the produce was procured by the government by providing minimum support prices policy. So the farmers had to sell their produce in the government farmyards or market yards, and there they would receive the prices which were announced by the government for these crops. And then these food grains which were procured from the farmers were then distributed to the poor urban consumers as well as rural consumers who were below poverty line through public distribution system. Then this public distribution system also had twin effects. Number one was that on one hand, the traditional grains which were earlier cultivated in the country, they were wiped out, which were rich in micronutrient, and these cereals or these grains could grow on inferior soils or in the semi-arid regions, which is like India is almost 60% of the area under cultivation falls under semi-arid regions, and in these regions, these grains could be cultivated at less resource-intensive mechanisms. Whereas on the other hand, the high-yielding varieties which were introduced through the Green Revolution, that is the wheat, rice, and the cash crops, they were highly resource-intensive in nature. So these were the simultaneous effects which happened in the Green Revolution, and then this led to emergence of a mixed scenario. The scenario which emerged was that on one hand we had aimed for making our public distribution more targeted, and it was improved. And this targeted PDS was to achieve nutrition security and food security. But it could not improve much of calorie, protein, and fat intake. But the consumption pattern was changed, because then through the PDS, only wheat, rice, sugar, these grains and sugar was provided. So then the benefits which the consumers received by buying and receiving wheat, rice, sugar through public distribution system. So those now they had the surplus, which the consumer surplus which they had now, that got diverted to non-food expenditure. It is not that the gains which they made through buying through or receiving food grains through PDS got converted into diversification of their food consumption basket, but all of that expenditure went to non-food expenditure. So then what the government did was that the government realized that this is what was happening, that the diversification of the food basket is not happening, and therefore we could achieve food security, but nutritional security was not there, and therefore the government came up with nutrition support programs. For example, Food for Work program was launched in 1977, then Midday Meal for Children was launched in 1995, Integrated Child Development Service, Public Distribution System, Targeted Public Distribution System, etc. All of these improvements were being done. In addition to that, the Government of India also launched the mission on cultivation and distribution of oil seeds, pulses, and maize. Then there was a mission on National Horticulture Mission, which was to increase cultivation and production of fruits and vegetables. There was a Silver Revolution, which aimed at increasing production and consumption of poultry produce. Then there was White Revolution on dairy development, where of course, we did achieve a lot of major increase in production of dairy, of fresh milk and dairy products. Then we also had Pink Revolution, which was for increasing production and consumption of meat, onions, prawns, etc. So all of this was in order to diversify the basket of food basket. So with these different kinds of government support programs, India did become a major producer, as well as it also became an exporter of certain agricultural commodities. Now, this increase in production and also contributing to exports led to an equitable distribution of benefits to small and marginal farmers. And also this also led to income of large, with the increase in income of large masses or large groups of populations, that also created demand for high value food commodities. So the increase in production and simultaneous increase in the income of large masses led to increase in the demand for this diversified food basket. Then after that also the government focused on development of food processing industries. Now with the development of food processing industries, there was increased consumption of high energy food consumption, which also led to a complication further. That was that this led to an increase in prevalence of lifestyle diseases. Now, simultaneously, the other studies have also observed that although on one hand we started talking about prevalence of lifestyle diseases because of the increase in the intake of processed foods by consumers in the country, there were also studies which noted that these nutritional levels were very disparate across gender, the men and women, and also different sections of the society, like tribals and non-tribals, urban and rural, and then there were studies which also showed a lot of disparity in the state-wise nutrition levels and state-wise kinds of diversity in the food basket. So all of that also led to some to criticism of the public distribution system, and this was also mainly the public distribution system was also criticized for the amount of corruption which was entering into the system of distribution, especially both in terms of procurement of food grains as well as in terms of distribution to the targeted populations. So because of these criticisms of the public distribution system, the government now changed its policy and shifted to the mechanism of cash transfers. Now, in more recent times, what has happened is that with our targets to achieve sustainable development goal, one of the sustainable development goal is, of course, about eradication of hunger by 2030. And in the present situations, what has been seen is that after 2016, in fact, the number of food insecure persons is rising, and Rambal et al. in 2021, more recent in his recent work, has indicated that the pandemic situation, or in the post-pandemic situation, we are likely to see the increase in number of food insecure persons. Now, this is also because that the lockdowns have interrupted and they have disrupted the food supply chain. chain, and also the kind of policies which we had shifted from direct cash benefit from public distribution system to direct cash benefit systems. Those are the kind of programs which got very majorly affected. Even though there were substantial food grains, and those substantial food grains can be distributed through universal public distribution system. However, that has not yet happened so widely, and that is where the government needs to bring its focus on, and to in the post-pandemic situation make instead of keeping it only as targeted public distribution system, to focus on on making it a universal public distribution system. The other thing is that the public distribution system can now also be expanded from the basic food grains of rice, wheat, and sugar, and other such commodities, essential commodities, to including provisioning of pulses, oil, etc. Because that is what is going to help people, have nutrition security. Now, the other problem that is emerging, and which is being seen already, and which is likely to happen or aggravate further, is that these disrupted food chains will now lead to increase in the food prices. And this increase in the food prices will have serious implications for the vulnerable populations in terms of the most important thing, that is the economic access to the food baskets. Because now, with the rise in food prices, it would become further difficult for these vulnerable populations to be able to afford or to be able to buy their food with these increased prices. So with these main challenges, what we need is that this is what calls for proactive nutrition security policies, which need to be developed and which have to be implemented, especially targeting the vulnerable populations, which are going to be affected severely in the post-pandemic situation, and which is already happening. And therefore, it is a serious concern, and it needs to be addressed on war footing. Thank you so much.
Okay, thank you, Dr. Sharma. Okay, we now have I see we have about 20, we
no 20, 50,
22 now. Okay, so we have around 20 minutes for questions. Okay, now I like to open for the discussion. Okay. If any of you like to raise question, please speak up now, please. Any question? Any three of them, that will be fine. Okay. Any question now? Yeah, please, Dr. Sharma, please.
I would like to ask a question to the presentation, which was related to Japan's imports of fisheries products. So my main question is, can you please tell me that how much is the proportion of imported fisheries products in the total fisheries consumption in Japan? So, I mean, that will let us know that how imports can affect the consumption for overall Japan as a country.
Okay. Can you hear me?
Yes, yes.
Okay. Thank you for your question. After the pandemic, the COVID-19, let me check.
I cannot hear you from you.
Okay. After, let me check. Sorry, wait for some minute. I check the number. Okay. After, because the highest import fishery in Japan is in 2019 December. It
is rate below to 80 million, but in 2020 May is below to 50 billion. So there is a difference.
My question was that how much is the proportion of imported fisheries product in total Japanese fisheries consumption? I mean,
Yeah, I have the data for that. You know, in 2018, okay, the self-sufficient rate for Japan fishery product, 59%. So which means that 40%, around 40% is imported, I guess. Yeah.
Okay, yeah, because that tells us that how important the imports are for Japan.
I think so. Yeah. I also found a question. Okay. I so surprised to see the result is no significant impact from the COVID-19. Okay, because from my personal experience, okay, I stopped eating raw fish. Okay, after the COVID-19. So it was replaced by the chicken or other products. Instead of that, I feel insecure, a little bit insecure on the fish product. I don't know how about you? So I feel unsafe. But the result and from AIDS model is very powerful model. Okay, it shows no significant. Well, that's the one kind of result. It just I feel that it should be some difference. Okay, any other questions? Yeah, from the floor, also or from the speakers. No, if you have a question, Dr. G, please. Dr. G, please. Yeah.
Yeah, thank you. I have a question for Dr. Sharma. Yeah, I'm interested in SDG. You know SDG, Sustainable, Development Goals. Maybe India also have some policies to achieve SDGs, especially in agricultural sector. Do you introduce some main policy?
Yes, please.
Actually, in fact, if you would see although from my presentation, it might appear that all that the government did was very good, but as a researcher, I can't say completely that all that the government did was very good. No. So the government of India has had very fluctuating policies for agriculture sector. If you see historically and until now, you would see that government of India sometimes did protect agricultural producers a lot, and also the urban consumers a lot. Then, but then on other hand, gradually they kind of, agricultural markets are completely regulated in India. Farmers cannot sell their products directly into the retail market, but all of those regulations are now gradually kind of released. So it is like you keep a child protected for a very long time, and then all of a sudden you throw the child in water. So agricultural policy has not been very gradual. It has always had sudden fluctuations. Whenever the political parties who are ruling, they would come in power, they would kind of change their stance completely for agricultural policies. But I look for a lot of hope in terms of the present government, and also the kind of attention that they are giving on agricultural markets reforms. So we also look forward to being able to achieving sustainable development goals through a lot of market reforms domestically. I mean, we may not be very bad in terms of international presence and in terms of international dependence, we may not be depending so much on international markets for procurement as well as for exports. But domestically we have been in a lot of mess for very long time. So now the government is kind of aligning its policies with sustainable development goal and with market reforms. So that is going to make our farmers more competitive in production, and also our the false kind of market protection will go away for output. So both input markets have now become liberalized completely domestically, and now gradually the policy is making output market also liberalized. So there is a lot of chance that in the beginning farmers may find it difficult. That is why you see protests which have happened in last 1.5 years from the farmers associations. Huge protests have happened, but that is because everyone resists to the change. But that change is happening, and almost 2/3 of the country has already accepted that change. So in those terms, I think especially for achieving food security and nutrition security, government's plans and implementation programs are very much in line with Sustainable Development Goal, especially of eradication of hunger. Only thing is that now the government will have to input more of public investment in distribution of food grains and other food commodities because of the pandemic situation, which we were doing very well before pandemic, but pandemic has rendered all the poor it has made the poor very poor, and those who were in fact above poverty line, they have also come below poverty line now. So now the government has larger populations to worry about. So that is going to be a big concern for Government of India.
Thank you. So I think the pandemic situation is very related to SDG, because
Yes.
as you said, the poor people have more advantage in pandemic era. So many developed countries have to develop the agricultural sector in developing countries. Maybe the method is ODA, right?
Yes.
So South Korea is also one of the main donors in global society, but India is not main partner. So I'm wondering which countries are the main partner in ODA, especially in agricultural sector.
In case of India, I mean, I don't think we receive lot of international funding for agricultural sector. We receive lot of international funding for our infrastructure and for retail trading and for ICT, information communication, telecommunication, all those sectors. In case of through ODA, I think we have very good links with Japan. So Government of India is having a lot of policy dialogue with Japanese government. And so for India, the concern is not in terms of so much of increasing the food grain production, but it is more of the distribution to the people who need it in time. So right now, government's focus is to improve our mechanism to provide what is required by these vulnerable populations. Now that vulnerable populations have increased, as you can see that in one of the studies, Rampal is saying that it is likely to be more than double, which is very difficult, which is very tough. But food security still the nation can address if we can develop a good distribution mechanism. But difficulties are more with creation of livelihoods and income securities, which is going to be very tough.
Well, follow this question. I'd like to ask
Thank you.
Dr. Sharma, what is the approximately that the food sufficient rate in India?
Again,
food sufficiency rate in India? What about in Indian? What would be what is your food sufficiency rate? I mean, food produced domestically. What is the percentage of that?
We are close to 1 in that food sufficiency rate. In terms of yes, yeah, because see, there are 4 components in food security. One is the which is related to production stability. So in that case, in terms of production stability, we are quite stable, and we have enough production every year, and we also have stocks. But we are not so good in the second component, which is called access. So and that access also has 2 components. One is economic access and the other is geographical access. So economic access is, suppose I am living in an urban area but I am poor. So if I am poor, I have no economic, I cannot afford that. So then I am insecure because of economic access. But sometimes I may be a little bit okay in terms of economic access, but I live in a very far geographical region. So then I don't have access to food grain, which is like geographical kind of inhibition. So there are several such factors which work for different people. Different factors make them food insecure, and in that, pandemic has added one big factor, and that is economic access. So many people have lost their jobs in urban areas as well as in rural areas, and that is why people will not be able to afford it. And these are the people who are not listed in government records as poor, because those who were listed in government records, government provided them access food. But those who were better, now they have become poor and they are not in the list. So they don't. So now they have become food insecure.
Okay. So I can see that the government want to focus on the what do you call that, distribution system improvement. Yeah, yes. That's very important. Yes. Okay. Any other questions from the floor? If not, I have one question to Dr. G. Okay, you in your presentation, you say that it's a survey to the Wuhan and to the Daejeon area, right? And you doing that online surveys, right, to the residents?
Yeah, I conducted this survey
okay.
online.
Online surveys means most of the respondents are young people, right? Young families.
Yeah, because we have no enough population, so we just targeted 20s, 30s, 40s. Yeah, maybe old people they don't use internet usually, so the survey company they have no enough population.
Yeah, online surveys is okay because pandemic, nobody want to go out physically, you know.
Yeah.
But what I wonder is, what do you expect? What do you expect that the old peoples in Daejeon, okay, in your country, in South Korea, are they respond the same way as the young people, the young families? You know, are they? Do you think that they will act different or they're the same, similar? to your survey. Yeah, to your questions. Yeah. You understand?
Pardon?
Yeah. Okay. Your respondents, your result, it come from the young families, right? Okay.
Yeah.
But so you miss some that family from the older generations. Okay. But what do you expect? Are they behave different or similar?
Yeah, you mean even though I didn't survey.
In Korea,
yeah. Old
your
people.
personal expectation, yeah.
Maybe they're more sensitive about the pandemic situation. So, yeah, their consumption behavior maybe, yeah.
Older people are supposed to be more conservative.
I never consider about that. Yeah.
Well, I just curious about. Hey, please,
Yeah.
Dr. Sharma, please.
I think what I can add here is that the older people and especially those who are living alone, or they would have faced much greater difficulty than the younger families.
Yes.
That is very true in case of India also. Those who were living alone, or maybe who didn't have anyone, and they did not. Many people, older people, they don't even know that if they can, send messages to some groups, WhatsApp group or some group, there will be others who can help them. They did not even know that they can reach out to ask for help. So like that, many people have suffered a lot, especially older people. And even if they had money, they didn't have access to go to market. And they were also worried that if they go to market, maybe they will, catch infection. So this during the pandemic and after the pandemic also, the older people have faced much more problem. Many of them did not have access not just to food but their medications also. This has been a big concern in India, at least. I've seen that, and it might be so in your country as well. If they are not, they have not been paid attention by the local government. If your local government has a track that who are the people who are living in far distance area, who are old, whether we should send them food, medication, whatever, only then. If it is proactively done by government, then only they would have been fine, but otherwise they would have faced difficulty.
Yeah, I think so.
Yeah, good answer. So yeah, in pandemic period, the delivery service industry developed a lot. Maybe young people's very easy to access the online methods, but old people, they cannot use or access. Maybe so the challenge is bigger than young people in pandemic era.
Yeah, I think so, because in Taiwan that Uber and Uber Food and Food Pandas, much growth rate in the last years, because they have received a lot of the orders from the younger peoples, but not from the elder peoples. They don't know how to do it. Okay, any other question from Flo? No. I think we have a good discussion here. Okay, and so I'd like to thank you for 3 speakers for your very informative and wonderful presentation and discussions. Okay, thank you very much, and stay safety. Okay. Okay, I'd like to conclude this session. Okay, and then we are going to the next session. Okay, in 2 minutes. Okay, thank you very much. In section 4, in not section 4, is 大家孔维新，我可以继续吗？啊，
继续
哈 ，OK 好 ，OK when I continue to another two papers, okay, these two papers are presented two speakers, one from Korea Rural Economic Institute, okay, and Dr. Yong-An Hong.
Hi.
Hello. Yeah. And the other one is Xu Shenzhang from National University of Kaohsiung. Oh, Xu Shenzhang. Okay. Also the same. Each of you have 20 minutes to present your papers. Okay. The first paper will be presented by Dr. Hong on the transition of consumption behavior and challenges in post-pandemic era. Okay. Yeah, please, Dr. Hong, please. Now, 20 minutes. Yeah.
Hello, my name is Yona Hong. I'm working as a research associate at the Korea Rural Economic Institute. It's very nice to meet you. The title of my presentation today is Transition of Consumption Behavior and Challenges in the Post-Pandemic Era. I'm going to talk about the change of consumption behavior in Korea after the outbreak of COVID-19, and then discuss challenges in the post-pandemic era. After the outbreak of COVID-19, changes in food consumption behavior have been remarkable. Consumers are eating out less and do more purchases of the processed food, the home meal replacement products, and healthy food. The e-commerce markets for food are dramatically surging too. As the impact of COVID-19 continues for more than a year and a half, it is understood that this change in consumption patterns is no longer a short-term shock, but has brought a structural changes to the food industry environment. It is causing a decrease in the growth rate of the food service industry, changes in the job creation sector, restructuring of the food retail industry. These changes are expected to leave various challenges even after the COVID-19 is over. In this graph, the green bar presents the household spending and the blue bar presents the consumption spending. In the first to third quarters of 2020, household spending decreased by 3.6% compared to the same period 2019. Consumption spending in the first 3 quarters of 2020 decreased by 3.0% compared to the same period 2019. This situation of households, of course, would have impacted their share of food expenditure. The total food expenditure in the first 3 quarters of 2020 increased by 2.0% compared to the same period last year. Interesting, right? During the pandemic period in 2020, home-cooked expenditures instead of eating out have increased, and it has reduced the proportion of eating out expenses out of household food expenditure. In the graph, the red part on top presents the proportion of eating out, and the blue part at the bottom presents the proportion of home cooked. The share of food expenditure in total food expenditure on eating out decreased by 4 percentage points from 49% in the first to third quarters of 2019 to 45% in the first to third quarters of 2020. By consumers less eat out and gathering people are being restricted by the government action, the growth of the food service industry was tackled by this change. Here was the growth trend of the food service industry. The size of the sales of the food service industry in 2019 had increased by 12% compared to 2016, reaching 130 trillion won. You can see those blue bars are gradually increasing, right? But sales in 2020 are expected to be about 109 trillion won, even lower than the level of 2016. According to the consumer survey we conducted last year, it was clear that people were eating out less instead of using delivery and takeout service. On the right-hand side, you can see the survey results about the eating out frequency. 81% of the total respondents said the frequency of eating out obviously decreased. On the other hand, for the number of delivery and takeout, 45% answered that it increased. Instead of eating out, going to the retail shop, what did consumers do to purchase their food? They used e-commerce market instead. E-shopping sales, including food service and grocery purchases, have been significantly expanding. In the graph, the blue bar presents the total online shopping transaction, and the red bar presents the online food service transaction. The share of food service online shopping transactions in the total online shopping transaction increased by 6 percentage points for the last 3 years. When you take a look at the consumer survey results about their use of online grocery purchases, 57% of the respondents said the number of online grocery purchases has increased. The outbreak of COVID-19 is accelerating popularity of healthy food and the home meal replacement products. Of course, even without the outbreak of COVID-19, in recent years, the HMR product purchase had surged very dramatically. In the last 4 years, from 2015 to 2019, the HMR market has grown at an average annual rate of 17%, led by ready-to-cook food. In the pie chart, you can see the types of food which increased the share out of the total food expenditure in 2020 comparing to 2019. Those include meat and processed meat products and ready-to-eat frozen side dishes. The story is very similar to the health functional food. Even before the outbreak of COVID-19, the health functional food market had grown dramatically too. The total sales of health functional food in 2019 was 3 trillion won, growing up 17% from the previous year. The proportion of the health functional food industry to the food industry rose from 2% in 2015 to 3% in 2019. After the outbreak of COVID-19, 78% of the respondents said that they consumed health functional food more frequently, which is an action to strengthen the body's immunity to prevent COVID-19 infection. The type which gains the most popularity among consumers was the vitamin and minerals, and the next was the ginseng. Facing these dramatic changes in consumption behavior, what would be the challenge for us? First, employment. The number of employees in restaurants had steadily grown along with the growth of the restaurant industry in 2016 to 2019. But mainly due to the outbreak of COVID-19, the number of employees has decreased by 10% in 2020 compared to the previous year. As you know, non-face-to-face sales and delivery services are leading to sales, which is a less labor-demanding business model. As restaurants are polarized into high-end large restaurants and small restaurants operated with minimum manpower, which is necessary to prepare for the fact that the existing self-employed and employees would be relocated or departed soon. Second, negative impact on farm income. During this pandemic, schools were providing their education service in an untapped way, and school meals were no use. According to Kim et al. 2021's estimation, in 2020, from March to May, for 3 months, a total of 633 billion won was unused due to the suspension of school meals, and the income of farms producing organic agricultural products decreased very much. As a result of estimating the decrease in the use of school meals by item, meat accounted for 168 billion won, the most, followed by vegetables and grains. Farms producing organic agricultural products in Korea highly depend on the market for school meal service and public procurement, so their income was directly impacted. Therefore, it is in need to diversify sales outlets for agricultural products. And government could come up with good ideas to use the agricultural products, such as the home delivery of the agricultural products package and students' food voucher support project, which was successfully done. If the situation continues, this type of efforts by the government and municipalities will be needed. Third, environmental issue. Food service online shopping transaction amounts to about 17 trillion won, and plastic delivery container and packaging materials cause a lot of problems now. Assuming that the minimum order amount for the delivery app is 20,000 won, about $20, the daily delivery order volume last year was about 2.4 million. Considering that about 3 disposable packaging containers are used at one time of delivery, including stock and side dishes, about 7 million pieces of garbage are thrown away every day. We nicely food in the plastic delivery containers, or may not nicely keep them. There are some efforts to use multi-use containers for consumers using takeout service, initiate the recycling campaign, and increase the use of eco-friendly delivery containers. Lastly, increase food insecurity for the vulnerable social group. Household income and consumption expenditure were more affected by COVID-19 in the vulnerable social group than in general households. It suggests increased instability in the eating habits of vulnerable households. Among the vulnerable households, 51% answered that their income level decreased. It was 41% for general households. And 42% of vulnerable households answered that consumption expenditure decreased. And the number was 36% for general households. In 2020, the food donated to the Korean Food Bank sharply decreased, making it difficult to operate the food support program for people who suffer from food insecurity. Food donations, which had been steadily increasing from 2011 to 2019, decreased by 12% compared to the previous year due to the impact of the COVID-19 outbreak in 2020. This is mainly because donations from the large food manufacturing companies have significantly decreased. I highlighted the food donation amount in 2020, and you can easily see the sudden reduction compared to the last year. In such crisis, food access for the vulnerable class becomes lower, so it is necessary to prepare the countermeasures for them. So far, I presented the change of consumption behavior in Korea after the outbreak of COVID-19, and then discussed the challenges in the post-pandemic era. Thank you for your listening, and any comments and questions are welcome. Thank you.
Oh,
I'm sorry. My microphone is not working. Okay. Thank you for Dr. Hong. Okay, and a very interesting presentation. Okay, I like the last few papers. I like to save the questions for later on. Okay, and the Q&A section. Okay. Now I would like to invite the second presenter. Okay, Dr. Xu Shenzhang. Okay, from National University of Kaohsiung on the solution of seasonal labor shortage in agriculture, a labor sharing program. Dr. Xu, please. Yeah. 20 minutes. Yeah.
Good afternoon. My name is Shen Zhang. I come from National University of Kaohsiung. I would like to first thank Dr. Chen to organize this wonderful conference. The topic I will talk about is the solution of a seasonal labor shortage in Taiwan, the labor sharing programs. And the talk of today's outline is first I will give you an introduction of Taiwan's labor shortage problem, and then I will show you the labor sharing program, which is called agricultural labor corps. Then I will give you some idea about the property of the agricultural labor demand of farms. Then we will discuss is the program sustainable. Then I will conclude and give you some policy implication. Agricultural labor shortage in Taiwan. Right now, we are facing an aging and shrinking agricultural workforce, and part of the reason is that agricultural income is only account for a small proportion of agricultural household incomes. So, if you're a young generation who are willing to become a farmer or work in the farms, and which income usually is low, and agricultural income is unstable. So, and working environment is not very pleasant. As everybody knows, when you're working in the farm, so fewer young generation is willing to put into the agricultural work. Also, the agricultural labor demand in Taiwan is that most of farms are small, so they cannot hire full worker regularly. So usually the labor demand is temporary, particularly during the harvest season. So because of the seasonal labor demand, so the quantity labor demanded and the frequency of demand vary widely across farms. Some may need a large amount of worker for 1 or 2 days, and others may need only one worker for 10 days. So the government kind of have implement some policy, and the priority is to provide agricultural labor in the short runs, and then in the long run, the government want to reduce the labor demand through mechanization, and also they want to satisfy the demand for seasonal labor by using only native workers. And but later on, or recently, the government kind of began to allow the farmer to using the migrant workers. Before we show you that data, the seasonal labor market without government's interruptions, there's no labor market because the reservation wage for worker is higher than the wage paid by the farmers. So there's no market existing. So after the government kind of provide the subsidy for or the incentive pay for the workers, so it will increase the labor supply, and so the market is created. So in this way, government kind of at the beginning tried to create a platform to kind of collect the workers to work in the farms. So the labor sharing program, which is started in 2017, so it only consists of native workers, and this program is have some influences by the pandemic, but it's only temporary because in early 2020, only a few infected cases happened in Taiwan. And the government kind of, because it's run pretty well, so the government beginning in 2019 to kind of allow the migrant worker to work for the farms. And the introduction of migrant workers is slowed down by the COVID-19 pandemic because at the beginning, the border is closed due to the pandemic. Then the border is open, but the migrant worker have to quarantine for 14 days. So it kind of adding extra cost for farmers. And so the migrant worker begin to enter to Taiwan or begin in early in late 2020 and in early 2021. But in recent months, because the infected case it kind of increased dramatically, so the government closed the border again. So right now there's no migrant worker can come in to Taiwan, but only within in Taiwan's for the migrant worker already in Taiwan, they can work in the farm right now. But before that, they cannot work in the farms. So we begin to introduce the labor sharing program, which is called Agricultural Labor Corps. It started at April 2017, and right now it consists of 5 corps. It's designed for different purpose. The first one is Agricultural Technician Corps, and they have high skill, and the government provides training in advance. So they want to attract a young worker to get into this corps, and they can get training, and later on they will assign to different farm. And the other one is agricultural labor. Agricultural labor is with a lower skill labor, and so they also will be assigned to a different farmer. So for agricultural technician and agricultural labor corps, they have to rotate from farm to farm, so to serve as many farms as possible. Then there's a crop professional, which is particular for tea and vegetable, and they will assign to particular farmers and without rotation. And the other one is machinery operation corps, and in this corps, they will provide a machinery service. So the farmer, if they need some service, they can ask them for service. And the last one is activated labor, which is using the existing people in the village, and some of them are elder, but they still can work in the farm. So they are kind of organized and to provide service for the farm. For the farmer need extra laborers. So all these agricultural labor corps, they are consist of native workers, and this worker will assign by the platform operator, which is operated by the farmer association, and they will operate on a daily basis. This is showing the operational mechanism labor sharing programs. So this is the platform which is operated by the farmers association. And so farmer he or she can kind of have a labor request, and then the operator in the farmer association, they will provide a worker to their farmers. And this is show the age distribution of agricultural labor corps, which is most of them are young compared to the whole population of farmers. And this show the a detail on kind of age distribution, which is separated by the different kind of agricultural labor corps. Particularly for the agricultural technician corps and agricultural labor corps, you can see that most of them are with age less than 45. As a total, you can see that more than 60% are age less than 45. And as for the sex, you can see that most of them are male. And as for education, you can see that this agricultural labor corps attract a lot of high education young people. For the agricultural technician corps and agricultural labor corps, they are kind of highly educated, particularly for agricultural technician corps, which have around 60% are college graduate. And the next slide is to show you why the agricultural farm works is not attractive for young generation, because you can see that on the starting time of farm works, most of them, around 60%, begin at before 7 a.m. So young people usually have hard time to get up early to work. This one is to show you labor demanded by the different types of agricultural labor corps. And you can see that most of the requests are only for 1 day of work. So you can see that for agricultural technician corps, there are 42% only request for 1 day and 13% for 2 days. So as the total, you can see that around 50% are the requests are less than 2 days. So farmer only need for 2 days of work. And this is separated by the different kind of farm types. So as you can see that for vegetable and fruit and flowers, and the main request only for 1 day. And so the limit demanded is kind of fragmentary. So we can, using another way to look at this request, for example, conditional worker demanded for 1 workers, you can see that for the request for only 1 day has 30%. And for conditional worker demanded for five worker demanded, then you can see that 50% are only for 1 day. So this shows that the labor demanded for farm is kind of fragmentary. So to satisfy this kind of labor demand, so if there is no labor sharing programs, this market is hard to form. Okay, so the labor sharing program is like the Uber. So because this market is small, so far it's hard to have a private sector to operate these platforms. The program is run until now, so I will show you some historical trends. So this is show you the workers, the number of workers working in the agricultural labor corps. You can see that the number of workers kind of increasing to like 3,000 to 4,000. But in the May 2020, there's only 1 month, which is there's a kind of an increasing infected case in Taiwan. So you can see that number of workers work in that month is kind of decreased. Okay, so but later on it goes up. In the early 2020, the decrease is not caused by the pandemic. It's caused by kind of the program is kind of shrinking. So that's why the number of workers is decreased. If we look at the personal days work in agricultural labor corps, you can see that this agricultural labor corps, they provide around like 30,000 to 40,000 of labor in the 2019. And you can see that the effect of the pandemic is happening in May 2020. And we can also try to compute the average worker hired by per farms, and you can see that the number is kind of decreasing, but it's stay around 2% as the mean, but it vary a lot. But in the pandemic period, particularly in the May 2020, you can see the number is kind of have a small decrease, but if we look at the average days of work per farm, you can see that it dropped a lot. So from this two graph, you can see that the farmers still hire same amount of worker, but the working day is kind of decreased. So, but fortunately, because the infected case was controlled very quickly, so in the next month, the days of work is kind of rebound. And this slide is to show you the compensation structure of the labor sharing program, because we say at the beginning, I told you that the earning for the worker is provided by the farmers, but beyond the earning, the government provides some incentive pay. So the horizontal line is the monthly income for a worker, and the vertical line is to represent the earning divided by monthly income. So you can see that these two have a negative relationship. Means that the higher the monthly income, the proportion of earning account for the monthly income is lower, meaning that the incentive paid by the government is higher. Okay, so the government kind of provides the incentive pay to attract the young worker to work more and to stay in the program longer. So because of the support from the government, is this program have a welfare laws? So we can using a very simple demand and supply framework to discuss this problem, because at the beginning there's no market, and after the government provide incentive, the supply increase. So you can see that for farmer, the benefit is A. The area A. So the benefit for the worker is that the area B, this is the producer surplus. And it also include the incentive provided by government is A plus B plus C. And we subtract the subsidy, which is A plus B plus C. And because of this program, which is operated by the government, so there are some transaction costs. We kind of denote it by T, capital T. So the total social welfare will be A plus B minus T. And as long as A plus B is greater than T, then the social welfare will be positive. Otherwise, it will be negatives. But in this case, we did not consider the social benefit of farm production. So if there is a social benefit of farm production, then the social welfare will increase the part of E. So the benefit of the social benefit of this program, it could be larger if we consider the social benefit of farm production. So here come to the conclusion and policy implication. So the labor sharing program, it does solve some of the labor shortage problem facing by farmers in Taiwan. And however, the labor sharing platform still need the government support. So in this case, it might generate a positive social welfare. But if we account for the social benefit of agricultural production, the social welfare of the program may be larger. So with this kind of labor sharing program, it did solve some labor shortage facing by farmers in Taiwan. So this program will continue, even though it kind of need the support for the government. So thank you for your listening, and the question is very welcome. I will see you in the conference.
Okay. Thank you very much for Dr. Xu for very interesting analysis on the agricultural sharing progress in Taiwan. Okay. Now we have around about 18 minutes for discussion. Okay. So I'd like to invite all of you to raise any questions. Okay, to these two papers. Please do it now. Thank you. Any question now?
I have a question.
Yeah, please.
Dr. Fu. Yes, this is Gordon speaking. Yes, I have a question for Dr. Xu. I'm very interested with the compensation structure of workers. Would you mind to explain a little more about that? Thank you very much.
Can you hear me?
Yes.
Yes.
Oh, okay. As I show in the presentation, because this program is kind of proposed by the government. So, and as you can see that in most of the country, the farm work is hard. So the young generation, they don't want to choose farmer as the occupation. So they don't want to enter the agricultural sector. So the government kind of think about to using some of the incentive pay to attract young workers into this program. So in this program, the farmer actually pay a wage to the worker, but the worker can receive so-called the incentive pay from the government, which include like extra subsidy, and some of them is kind of a if they can work for 1 year, they will get an extra bonus. So in this way, they want the young generation of the native Taiwanese, they to stay in this agricultural sector. So so far the program is already run for like 4 years. So a lot of young workers, they actually learn a lot of skill in through learning by doing. So so I think it's kind of a successful program so far to solve the labor shortage problem faced by the farmer.
Okay. Any other questions? Yes, please, Dr. Sharma.
I have a question for Dr. Yeon Hong from South Korea. I wanted to ask you that what is the mechanism which your municipal corporations or city corporations are planning for waste management? I understand that that is a similar problem that all the urban areas world over are facing, that after pandemic, this mechanism of ordering food online has become very common, and many people are buying not just food, many things online. So, and all of that is delivered in plastic packaging. So, is there any plan which your government is implementing to do the waste management and how or recycling of plastics can be done? Because on one hand, after a lot of struggle, we could implement plastic polythenes ban in the country, and now we are facing that again the plastic is there in all our consumer baskets.
Yeah, thank you for your question. Yes, the delivery and takeout service is growing very much, and I don't think this trend will be reversed. It will continue. And plastic delivery containers are very problematic. And actually, there is no actual solution to reduce those, right? But now consumers and the government are concerning that it will be accumulated, and there is no way to reduce, right? So as I said on the presentation, the efforts are made to make the container several times, and we are doing campaign to less use plastic container, and actually R&D by the food manufacturing company is conducted right now. I mean, to make the plastic containers can be more fermented. In a fermented way, they can be just how to say, it would not last long in the soil, right? So if they develop some better material for the plastic, I'm not a scientist, so I don't know how to use the term.
Degradable. Yeah, degradable.
Yes, right. Yeah. So that's what the food manufacturing industry are doing right now. But we'll see.
Yeah.
Okay,
Yeah, I think
thank
this
you.
is a very interesting issue, environmental issue that they coming from the pandemic effect. Okay, because in Taiwan that our government that require that the shop they cannot provide free plastic bag. Okay, yeah, they ask the consumer to buy it. Okay, $2, Taiwanese dollars for one bag, and so on. Okay. That's one way to reduce that the plastic bag, I guess. Yeah.
Yeah. And actually, I don't know the diet habit for Taiwanese people, but in Korea, we eat the main dish and several side dishes, actually.
Okay.
When you order the food, so many plastic containers are coming along together. So maybe we need to educate people to select only main dish, not side dishes, something like that. So there should be some kind of educational program for people, I think.
Yeah. Okay. Yeah.
In Taiwan, we have a similar problem. Yeah,
oh, really?
So, yeah, it's a similar problem because when you order a meal, you include a lot of things. So they have a lot of separate plastic container. So I think the environmental issue is troubling, you know. So unless we can create some kind of material, it's easy to decay. Otherwise,
yes.
I guess we have to, encourage that. Put us a hamburger, put everything in one bun.
Right, yeah.
Okay, any other question?
Yeah, I have one more question. I have this question for Dr. Xu from Taiwan.
Yes, go ahead.
Yeah. This mechanism which your government is adopting is very interesting. So I wanted to ask you that how is the location sharing done? I mean, the list of all those people who can work as labor or machine operators, their location with the farm location where it is demanded. Because I was thinking that can this be thought for India as well? But because India is very large and the location of the labor is very far from where the farm workers are required. So that's why I was thinking that how is it in case of Taiwan? That are the workers available nearby or how is the mapping done?
Actually, thank you for the question. Actually, this labor sharing program, it's kind of only consists of around like 30 worker as a group. So they kind of work in the area of a small town. So if these small town areas they have a particular certain labor problem, the government will form a labor corps over there, and in this way the worker don't have to travel a lot. But in some case, the worker did actually have to travel a lot. So the government kind of provide some kind of a transportation fee for them, extra transportation fee to pay for them to travel maybe 1 hour to the working place. So if you want to work, let this kind of agricultural labor course work, you have to focus on a small area. The area cannot be too large. So the group is a small group in this town and small group in the other towns. So so far, we did face some problem because the worker kind of sometimes they will complain they have to travel a long way to the workplace and working for a day and come back. So we did have this kind of problem. So the government think about that. So they give them transportation fee to compensate it. Yeah.
Okay. Thank you.
Okay, I have a following this question. Okay, I like to ask, is this a public program or a private program? Yeah.
This is a public program.
Can it be run by a private company? I mean, since it can be run, I mean.
It's I think the purpose of this program, the government think that eventually they want because the workers join this program, they can only work for 5 years. After 5 years, they have to some kind of graduate from this program, and the government want them to kind of learn skills through this program, and later on they will be able to sustain by themselves because their skills are good, right? So they hope the farmer will pay them higher wage. So, and this kind of a experience running by the Farmers Association, they also want the Farmers Association to kind of to have a kind of a mechanism to learn through this mechanism, and later on it will be run by the private sector, not by the government. But so far it's still on the way. So it still rely on a lot of public support. But as I show you that if you consider the social benefit from the farm production, because right now a lot of farmers, they are very old, so they cannot have enough labor to produce some of agricultural product. So if government did not provide this kind of labor for them, they might kind of just give up farming. So if you think about this way, maybe it's worth some of the support from the government. Yeah.
So currently, are these workers part-time workers or full-time employee?
For the agricultural technician corps and agricultural labor corps, all of them are full-time. They are working full-time, so so they will be assigned to different farm. But if they are working by themselves, it's hard to find the farmer to work. So it's kind of like an Uber. So like it's operated like an Uber, or the government want to kind of using this kind of labor sharing program to solve the seasonal labor problem.
But if they work full-time, then because the harvest time usually are seasonal, you know, bi-seasonal. Okay, so can they afford themselves? I mean, survive?
That's a good question, because in order to have this kind of labor sharing program, so when government design this crop, they have to think about that in this area, there are several kind of seasonal labor demand. So, for example, in the maybe in the April or May, there are one particular crops that they need to harvest, so they need a lot of labor. But in the cross area, in July or in August, there are another demand. So the design of this crop have to consider the demand of different crops. But it actually sometimes happen that there's not enough demand for the worker. So in this case, it did actually have some problem. But the farmer association have to find some work for the worker. Yeah.
So usually, I think that these workers maybe already a native farmers, or you know, or the new farmers. I mean, the policy objective is trying to train the new farmers. Which kind of objective is that?
This is another issue people kind of talk about. Is because the purpose, one of the purpose to attract the farmer from the outside of the agriculture sector, but it did have some of them already work in the agriculture sector, but they did not have a regular job. Maybe they are very small farmer because they only have a very small piece of land. So in most of the time, if they rely on their land, they cannot sustain for their family. Yeah. So in this case, they can work in this agricultural labor corps, and in their part time, they can work at their own farm. Mm-hmm. So in this way, they kind of keep them working in the agricultural sector. Otherwise, they may just give up the land or rent out the land, and they will move up the agriculture sector. Yeah.
Yes. Okay. Thank you.
Yeah. We did find that a lot of young people, they are interested in agriculture, so they go into this program, and there are some successful story. Yeah.
But that's for summer camp. I mean, that's that is summer camp, not just worker that the farmers want.
But I have a question. Worked for like 3 years or 4 years already.
Okay. Yeah. Okay, Dr. G, please.
Yeah. I think it's very useful program. Yeah. Sometimes new worker enter the market. In that case, maybe they have no any information, knowledge or skills about agriculture. is there any training course? And how to guarantee the labor quality of the labors?
Okay. Thank you for the question. And this is another issue because some of the workers they have no experience of agriculture, so the government kind of provide like 10 days of training in advance, but the 10-day training is not enough. So at the beginning of programs, when they join this program, their skill may not be satisfied by the farmer. So it did cause a lot of complaint from the farmer. So the government tried to fix this kind of situation by kind of provide training in the farm. So try to improve their skill. And as knowledge, as far as I know, those workers may need like maybe half years to learn the skill, and that farmer can satisfy. So it did have a lot of trouble at the beginning because a lot of workers recruit by this program, and they don't have enough skill to work in the farm. So it did have a lot of complaint at the beginning, but so far the program already run for 4 years. So that when new worker comes in, right now they have more training and they know how to train them. So I think it's kind of because it's experimental program. So so far I think it's run quite well. Yeah, but it did have a trouble time at the beginning. Yeah.
Okay, thank you. Any other question? Okay, if not, I think that we have already run out of time now. Okay, so I like to conclude this section. Okay, section 3, we have 5 speakers, and each of them has presented very good presentation, and we'll also have a very good floor discussion together. Okay, thank you very much for your attending. Okay, and I now hope you have a very good summertime vacations in each of your country. Okay, and stay safe. Thank you very much. Say bye-bye, and stay online now because they have a closing section, I guess, right? Is that right?
Thank you for participating in today's webinar. Lastly, we would like to invite the President of Rural Economic Society of Taiwan, Yu-Hui Chen, and the President of the Korean Agricultural Economic Association, Hong-Sam Kim, to make the closing remarks for us.
Colleagues and participants, today's webinar instills a warmth into academic exchange that have stayed less vibrant over the past year. We have total about 10 papers presented here. Scholars from Korea, US, India, and Taiwan share with us the research on the impacts of and likely responses to COVID-19 in the area of agriculture, labor, consumption, trade, price, food security, and health policy. We very much appreciated this extended discussion, which enables us to receive more relevant information and learn from others' experiences to tackle and address the challenges ahead. Thank you all again for your participation today. We send particular and sincere thanks to Korean Agricultural Economic Association and President Kim for their great support that helped make the conference successful. We hope the pandemic will end soon and life could go back to normal as we all wish. We wish everyone stay well and healthy. See you in Korea next year.
오늘 웨비나에서 발표를 해주신 발표자, 그리고 토론에 참여해주신 토론자, 세션을 이끌어주신 자장님들 모두 긴 시간 수고 많으셨습니다. 이번 웨비나에서는 10개의 논문 발표에 나타난 한국, 대만, 일본, 인도, 미국 등 다수의 국가 사례를 통해 코비드-19 팬데믹이 각국의 농업, 식품 소비, 노동력 수급 등에 미친 영향을 살펴보았습니다. 물론 국가마다 차이는 있지만 국가와 지역 그리고 개인 차원의 식량 안보, 영양 안보와 농식품 산업에 직간접적인 영향을 미치고 있음을 확인할 수 있었습니다. 그리고 포스트 팬데믹 시대를 맞아 농식품 분야가 어떻게 대비해야 할 것인가에 대해 논의할 수 있는 매우 뜻깊은 시간이었습니다. 또한 각국을 대표하는 학자들이 모여 연구 성과를 공유하고 그 대안을 모색했다는 점에서 그 의의가 매우 크다고 생각합니다. 코비드-19 상황이 조속히 종식되어 국제사회 구성원들 모두가 정상적인 삶으로 복귀하길 기원해 봅니다. 그리고 내년에 한국에서 개최될 세미나에는 여러분들 모두가 직접 얼굴 마주하는 대면으로 안심하고 참석할 수 있기를 기대해 봅니다. 어려운 여건 속에서도 이번 웨비나를 성공적으로 진행해 주신 첸유후이 회장님을 비롯한 대만 농촌경제학회 관계자분들께 다시 한번 감사드립니다. 모두 건강하십시오. 감사합니다.
Your mic is off.
All right. Okay. I think we have am I closing the whole conference or someone will close the conference?
I think we may be able to leave. Bye.
Okay. I think that okay. Now everybody, okay. I think we have a very good discussion in the afternoon, and I'd like to say hi to all of you and say goodbye and see you maybe next year. Thank you.
Yeah.
Bye-bye. Bye-bye.
Thank you.
Bye-bye. Yeah.
See you in Korea.
Yes,
Next
yes.
year.
I will do that. Thank you.
Bye.
Thank you. Bye-bye. Bye-bye.
The theme of COVID-19's impact. The pandemic would ultimately fade away.